I think we're just waiting on two folks.
Two folks?
Koa up in Colorado and Rita in New Mexico. Can you all hear me okay?
Yeah.
I don't have my microphone on, but because this is such a hands-on, I'm going to be touching my ears a lot, showing my ears. So, but let me know if you're having trouble hearing me, okay?
Okay.
The baby's just in the other room, and so I might put him on later if I need to. But why don't we do, you know, since y'all showed up on time, we're just waiting for them to trickle in. I just want to do a quick check-in, like where's everybody at? How's everybody feeling about completing the ADS training? You know, what are your, you know, the big questions you have coming up? We've got a full class today. It's going to be a little bit more hands-on and a little bit less kind of didactic and really kind of helping you to get your head around your mind and your heart and your, I guess, your mind around how to bring this technique into, you know, how to pragmatically just apply it in clinical settings in this type of environment. So we'll go through that today. But where are you all at? How is this feeling? You know, you've all sat through some pretty long webinars and you haven't given up yet. You've kind of stuck with me through some pretty long afternoons, and I know that it's a lot of people are approaching Zoom burnout. And so I appreciate y'all hanging in there. We've got a nice tight group, but I'm curious where you all are at. Can everybody maybe do a little check-in around that?
Yeah, I can go first. I think I'm doing okay with it. I'm just really excited. Last class, the addictions one, just, I don't know, something about it, I got more excited. I'm really excited to work with the ear today. You know, I just decided to get all of the readings printed out, or the manual printed out, and then having it bound. So I'm gonna pick that up today so I can start looking through that. So I've got a lot of the reading to do. I haven't done much of that yet, so I don't know where I'm at.
Great.
Okay. Bueno, I almost dropped out, but then I couldn't sleep because I'm enjoying this. I enjoy learning, and it's another technique, and it's another way to do something. And I'm very excited to be here. I'm just very happy to be here. And yeah, yesterday I was doing the same thing as you were, Kelsey. I got all of the readings organized and printed out and put in bundles according to module, and then and that's when I decided I gotta take this module, you know. So I'm here, and I'm very glad to be here.
I'm a little unsure where I'm going. I'll admit that right now. Lots of changes with my workplace and my home. We're actually under renovation. Oh my goodness. I've got, right now, in an 850 square foot bungalow, we have 4 adults, 2 dogs, and a cat. So we're a little squished. In Ontario, in Canada, our regulation states that only a registered acupuncturist can do any needling. So, you know, there's nobody around here that does NADA that I'm aware of, especially now. Our regulation came in about 7 years ago. And I did do a little bit of auricular training in the past, but not specifically in NADA. So I'll be able to follow along there. Not sure where I'm going to go with the training. I'm really interested. It just might be a while before I'm able to complete the whole thing. So I'll do this module, and I guess I'll just keep an eye on the website and see, you know, when things are offered again, and hopefully be able to jump in, even if it's 6 months down the road, and do another module. And I do kind of hope to come down and do the practical training at some point, but that might be a while. COVID's left me in a little bit of debt. So I've got to kind of catch up on things here first. So that's kind of where I am.
Are you an acupuncturist,
Yeah.
Bonnie? Okay. And you
I can
also?
do regular
Kelsey?
as well. So
Oh, okay.
yeah.
The three of you are all acupuncturists, entonces.
I'm not. I'm a
Oh,
counselor.
You're the counselor. Okay.
Mhm.
So
Okay.
Takoa and Rita are also not full body acupuncturists, don't have any acupuncture training, and so we got a nice balance today. So yeah.
Okay.
Um,
Great.
Yeah, Sierra, where are you at?
Yeah, I think I'm kind of similar to Bonnie, and there's a lot of changes happening in my little part of the world, and a lot of uncertainty and instability. And I feel like good about the training. I love being in a group. I love the topic and the content of what we're talking about and learning. And so, and also, part of my NADA training is in an effort to support our, uh, you know, goal of getting some type of ads certification law in California.
Mhm.
And so I'm kind of like, right now I'm balancing, like I have this clinic that we're struggling very, very much to keep open and to continue serving the community in the way that we have, but we're not allowed to do acupuncture right now. So we're rethinking everything. And I don't know, my brain is like full of ideas and worries, and I just don't know what's going to happen in the next 6 months to a year to a year and a half to 2 years. But I definitely want NADA to be part of whatever is in my future. I'm just not sure what it's going to look like.
Cool. My goal today is to get all of the, I don't know, semi-boring stuff out of the way, just kind of the root information about universal precautions, clean needle technique, best practices, how do we do this in COVID-19 environment, all of that informational stuff kind of out there, and point location, and I'll point you in the direction of some YouTube videos that when you do start practicing, you can reference to help you keep on track with practicing and getting your confidence up. All right, but we want to get as much in today so that you arrive at that face-to-face training, not like, okay, what is universal precautions again? Because we want that full day of training to just be practice, right? Needle in, hands on our feet, right? And that will set up for a really good class that we can organize together. Sound good? So we're going to cover clean needle technique. We're going to talk about all the equipment. We're going to talk about handling needles. We're going to talk about posture, position, working with people. I'm going to do a little demo on my partner, and if the baby is up, I'll even show you how I needle my baby's ears, so you can see how that goes. And we'll talk about group management, best practices, group management. We'll talk about talking with people about needle sensations, normal needle sensations that we want to be a little bit more careful about. That's an indication we need to adjust the needle or take it out. So yeah, we're talking about ear seeds and beads and self-acupressure, which is stuff you can start practicing right now. And with the seeds and the beads that you got in your hands, you can start using that, okay? On the people. Yeah, go ahead, Bonnie.
Totally off the wall question. Have you ever tried it on animals? As in like dogs? I have a dog that's terrified of thunder.
I have.
Yeah.
In New Mexico, you have to be a veterinarian in order to do veterinary acupuncture.
Unless it's your own
But in
pet.
other states, your local regulations, you might check them. There may not be regulations about treating animals.
Yeah, I mean, I can treat my own animals, but I can't treat anyone else's. Like I can't practice as a veterinary professional.
Yeah. I mean, I was at Six Flags. I was at Six Flags 2 years ago, and there was this giraffe, this huge giraffe that was neck pain is managed by giant acupuncture needles being inserted on a regular basis. So it's there's even plant acupuncture, So and I don't really have any training or expertise. I've just experimented a little bit, and so yeah. Any other questions before we dive right in?
I was just going to say, sorry, I'm late. Trying to use 2 different laptops here, and I couldn't get logged in on either of them, so that's why I'm late.
Well, welcome. Glad you're here. So,
There you
cool.
go.
So let's just dive right in, okay? Now, the simplest way to help to use the ears to help your own healing or other people's healing is just to do some acupressure on it, okay? And so without even knowing where the right points are, as we've talked about in the trainings, I'm, as a teacher, in my experience as an acupuncturist and as an NADA trainer, feel that any point on the ear can be, or any point on the body, giving pressure to it can have some therapeutic benefit, okay? So we don't know, maybe you don't know where these points are, no problem, right? That getting over the hump in getting your confidence in needling is gonna have to put a check on the critic inside you that wants to have the perfect point location. Early on, I encourage you to develop technique and confidence, good technique and confidence, right? Over the precise location, you know? We can get really obsessed around the right location, and there's time to improve that, right? And a lot of that will come through your one-on-one training and your internship. But getting your confidence up. How do we handle the needles? How do we handle the ear? Our confidence in diving in there, right? It starts right here. So I want you to grab your ear, right? Turn your video on if you can, Takoa, so we can kind of stay together in this, okay? Rita too, yeah, go ahead and turn your video on, and let's just put your fingers on your ears, thumbs on your ears, okay? And let's just start to give it a massage. And I want you to touch every little part of your ear, okay? And see what that's like. The bottom, the top, the inside, the out, back, front, okay? Just kind of crawl around, explore, okay? What's that feel like? You know? What parts are harder? What parts are softer? All right? What parts feel good? What parts don't feel good? All right? And so yeah, you can just kind of like massage like that, or you can press in and out, like pinch the ear and press, or you can put one finger and just put it into the point. I like to have the thumb on the front and the fingers on the back, okay? All right, you can give it as vigorous. See what it feels like to give it a very vigorous pressure and massage. And then see what it feels like to give a lighter massage. Is there a difference? Does it feel the same? All right, are there points that are more tender? So acupuncture starts with observation. Working with people in addictions and behavioral health starts with observing ourselves, observing the person, bringing awareness to what the person's feeling, to what we're feeling, staying in that sync. That's what the spirit of NADA is all about, right? So, right, it's less about I'm the professional who's going to give this magical thing and plug this into this button and you're cured. It's more about a relationship. How do we stay on the same wavelength? So let's just see what that's like, okay? Okay. How did that feel? What are some sensations you felt? Emotionally, energetically, physically, what happened?
Well, there was definitely a difference on that. What is the first one? Sympathetic. It seemed like if I pushed in on that, there's just, I don't know, just like a lightning. It felt like, you know, a lightening.
Lightning. I love it. Cool.
Not like a shot of lightning, but lightening the load type of feeling in the air, I guess.
Great. Anybody else?
My Shen Men was super tender. Like,
Okay.
oh, maybe I am stressed, huh?
Great. Anything else?
I was gonna say a warm, like sensation, like, actually, like pretty warm, like just kind of a heat, like came over me. I felt good, but it was like, yeah, like a warm sensation.
All right.
I'm kind of aware that my ears are there. I really hadn't thought about them before, but I can feel them there. I don't know how to explain it, but I just feel them.
I actually feel my neck and shoulders are a little less tense. I've been sore. I've had a little bit of sciatica lately. And so I started rubbing down, which if I remember correctly, where the spine is, and it feels a little bit better.
Great.
Wonderful.
I'm gonna put a little video that I created a few months ago. That's just that activity, okay? And it also walks people through how to find some of the points. It's like, I don't know, like 5 to 10 minutes, and you can share that with people that you can't be in touch with. You can't treat them right now. Patients you have, right? Even if you can share with them and encourage them to do it. And then you can also do what we just did together, right? We also did a series of acupressure workshops focusing on NADA, but other points, right? These were 1 hour workshops that we did for COVID-19 social workers, counselors, teachers, people who are to support them in their own stress management and teaching them how to do it for others, right? And so we don't have these built into this class, but those are the one of the things I want to have Savannah get out to you all, is those classes, and you can kind of browse them if you want to go deeper into seeing, you know, how to actually, you can facilitate Zoom groups like this. Just doing that. That's a lot of what I've been doing for the past 3 or 4 months, meeting with our students like you all, and doing this type of thing, practicing, and then showing you, teaching you, empowering you to be able to go out and do this in your community. All right. And encouraging people to teach other people. It's really not that complex, right? You don't need a certification or a license to even just teach that basic stuff. Okay. So yeah, and then so what I want to encourage you to do, particularly with a focus on needling and actually working with people, and as you start to needle people, you're going to have this interface with people's experiences, and people can have all types of experiences with acupuncture and acupressure, right? People can people can feel all sorts of odd things. I've heard people tell me things I've never heard other people tell me before about what it feels like, right? And then one point bleeds, the other point hurts, and what does this mean? And with the spirit of NADA, what we really encourage and model within NADA is to observe, not judge, right? And maybe as acupuncturists, we've learned that, well, if this point's tender, it means this, right? And there's validity to that. And there's lots of schools of auricular medicine out there. Lots of teachers. You're going to get lots of different answers if you ask different types of ear acupuncture and acupuncture teachers in general, what it means when this means this sensation is felt. But what I want to encourage you to do when you're working in the NADA context, in a NADA group, observe, not judge. So maybe, you know, if a point bleeds, does that mean that point has some sort of spiritual significance, that point is bleeding, the heart point is bleeding? Is that have something to do with my heart? Maybe in other schools of acupuncture, it means something. But in NADA, we just observe, don't judge, right? We're not going to assign meaning, good or bad, right? Oh, that point, well, you got a good Shen Men point there. Whoa, you got a beautiful looking ear. Whoa, that's a weird ear. So these all have an impact, will have an impact and affect the NADA experience, right? And people are like, why does that point always hurt? Huh, that's interesting. You know, I'm not sure. You know, points can hurt at any time. You know, certain points can hurt, doesn't necessarily mean something. The important thing is we want patients to tell us if it's uncomfortable. We want them to tell us so we can assist them. So NADA, we're also creating a conversation, a very direct conversation with people about their experiences. You know, we don't want to assign meaning, but if it's uncomfortable or pinchy or sharp, then we don't want that. We want to be responsive to that. We want to give the person permission to speak up. I'm not feeling comfortable, and it's your responsibility to step in and to know how to adjust things and make it more comfortable, or even just take the needles out. Right? So any questions about that? So those are real fundamentals that really underlie a lot of what we're going to cover today. Right? And a lot about the whole spirit of NADA is really being in tune with our patients. Right? Now, it's not to say we want to take away all stress and discomfort in this person's life in front of us. That's not our job. Our job isn't to completely get rid of pain and discomfort, because life is painful, life is uncomfortable, particularly if you're recovering from drugs and alcohol or severe mental illness, or you went through a traumatic experience, right? It's an uncomfortable experience. So part of the detox process, part of the process of recovery is pain, right? But what we want to focus on is needles causing the pain. Is it a sharp sensation? We might need to adjust that. But people might feel stuff. You know, I have a lot of people all the time. I was feeling really relaxed in the acupuncture treatment. And then all of a sudden, I got anxious. Why? Why did I get anxious? Did the needles make me anxious? A great question is that I ask them back is that I find helpful is like, well, do you ever feel anxious? Oh yeah, all the time. Oh, okay. Well, yeah, you might have anxiety, you know? You might have, we don't want just, the purpose of NADA is not to just deadline, people, like numb people out. Like, remember we were talking with Will the other day, right? The medication world just numbs people out. That's it. Does one thing. Does that very effectively, like a sledgehammer, and it has side effects after that numbing out process. We're not just numbing out. People might experience numbness, but we're not just numbing people out, you know? Acupuncture is not a drug. It's not a pharmaceutical. Some of the stuff people feel with acupuncture might be similar to a drug experience. Relax, numb, right? They might feel some peace, some calm, euphoria, right? So they might feel more energy, but it's not a drug. It doesn't have the side effects. It's not addictive. And it doesn't create like the dependency. If there's codependency that evolves out of the acupuncture experience, right? There's codependency. This person is dependent on you in an unhealthy way. Then that's something for you to check on your end. What's going on with you? What's going on with that treatment context you're in, right? You know, and what needs to be modified, or maybe somebody else needs to come in your place, and you just step back with a particular patient, right? So, but acupuncture itself doesn't create that dependency. You know, my own personality and my own shit, my own unresolved shit, my own baggage that I bring into the treatment, that's for me, that's the most invasive thing in the acupuncture experience, right? So that's constantly having to do my work. So yeah, but we're all health providers here, so I assume we all have had training, right, in this. We've all had supervision in this. Maybe you've had to get your own therapy around this, and this is, you know, just encourage you to keep doing that. You know, seek help when something is over your head. If you're particularly around needling, you know, if you're having some experience with somebody over and over, and you don't know why it's hurting the person, all your needles hurt, get help. Reach out to me. Let's talk. you know, chances are I can give you some pointers, right? You might have a supervisor you're working with, and they're a great resource in that too. So those are my introductory remarks there. Let's move right into some clean needle technique 101, okay? So clean needle technique, NADA clean needle technique is a little different than the NCCOM acupuncturist clean needle technique, but there's a lot of common ground, all right? So, what I want to pull up is the NADA training resource manual. So if you got that book, go ahead and open that up. All right, can everybody see the big ear in front of us? Okay. Everybody still see that? Okay, great. So, give me 1 second to get myself oriented here. Okay. So here at page 50, oh gosh, where did that go now? There we go. Kind of page 50 onward, we've got a lot on clean needle technique, okay? I'm having trouble scrolling these pages, so I'm gonna take it off of full screen. Just give me 1 second. We'll just do one page at a time. There we go. So the first part, exposure control procedures. First off, your agency and your clinic should have your own exposure control plan that should be wrapped into your own safety and emergency procedures plan, okay? Right alongside your CPR training and any other stuff you all are doing to keep your clinic safe, right? And so anything you learn here needs to could be trumped by local regulations, right? These could be city regulations right now. Right now, there's a lot of regulations on health activity. What is essential? What is not? You've got to follow your local guidelines, right? And within your agency, there may be regulations, policies, and procedures to be aware of. So the NADA just kind of fits behind that, okay? These are some universal stuff, some international standards, right? And then you also gotta filter that with local stuff, okay? And what we're talking about is not getting to the point where there's no risk involved. All right, there's no harm possible. Anytime you're working in healthcare, there's risk. Somebody can get hurt, right? Just by talking with somebody, especially now, talking with somebody can get, you can give somebody COVID-19 and they can die, so you can get affected by them. So we're not talking about getting rid of risk, getting rid of danger. We're talking about risk reduction. So we're going to learn best practices to reduce the risk. Okay. Most of us, everybody here is a healthcare provider. And so any questions about what universal precautions are at all? Okay. So here on this page in the NADA training manual, we are at page 51, universal precautions. Okay, so universal precautions are a set of precautions designed to prevent transmission of HIV, hepatitis B, and other bloodborne pathogens when providing first aid or healthcare. Okay, So we're going to consider all bodily fluids potentially infectious of HIV, right? Now, universal cautions, we're also going to be mindful of airborne pathogens, right? Tuberculosis is an airborne pathogen, flus, bacterial infections, right? And right now, the big one, COVID-19, is an airborne infectious agent. We're going to assume that anybody coming in could have COVID-19, even if they don't have symptoms. COVID-19 symptoms include shortness of breath, cough, sore throat, sinusitis, headache, diarrhea, nausea, flu symptoms, body aches, fever, different symptoms. But people cannot have any of those symptoms and they can have COVID-19. Just like we can't tell by looking at somebody whether or not they have HIV or hepatitis B. Right? They can seem like a healthy person and they can have these infections agents in them, okay? HIV and hepatitis C are extremely difficult. I'm not aware of evidence that acupuncture has actually been an agent of infection for transmission for HIV and hepatitis C. Okay, you would need an open wound with blood, right, and an end of a needle with a drop of blood on it, and then intentionally trying to infect that spot. Okay, hepatitis B is a little, from what I've learned, is easier transmitted through an acupuncture needle. So how can we reduce risk from hepatitis B? Get a vaccine. If you're a healthcare provider, any type of healthcare provider, it's highly recommended you get a hepatitis B vaccine. There's no vaccine for HIV and hepatitis C, right? But regardless, all that I just said, we're going to assume that any drop of blood, any blood, could infect us with HIV, hepatitis B, hepatitis C, or any bloodborne pathogen. Okay, we're going to treat it all the same. Any questions about bloodborne pathogens? Okay. So one of the universal precautions we're gonna remember is whenever we anticipate coming into direct contact with any bodily fluid in a NATA setting, all right, with our hands gonna come in contact, we're gonna glove up. Other than that, it's not recommended to use gloves. Okay? Even in the COVID-19 environment, it's not recommended to use gloves. The needle stick to yourself the risk of that goes up when you use gloves because you just can't handle the needles that well. All right, your confidence, your ability to grasp the needle and put it in goes down. All right. Now you may have an agency where they ask you to glove up, or they require you to glove up. Then you're going to glove up. Okay. All right. So yeah, right now, part of our personal protective equipment and our universal precautions is going to be, we're going to wear a mask all times. Okay. That's one of our personal protective equipment. Ideally, you should wear a face shield as well. Ideally, you should have an N95 mask. Okay. And ideally that, and then after you use a mask, you should put it in a Ziploc bag or a container for 3 days after you use it. Okay. You should wear a separate pair of clothes to work. Change into scrubs, I would recommend. All right. When you get to work, bag those up, come home, change your clothes, everything goes in the wash. All right. We're protecting ourselves and we're protecting our clinic. We're protecting our community by doing these things, okay? Blood is a common thing when you remove a needle, all right? And so we're gonna reduce the risk of coming into that contact by always giving somebody a cotton ball to clean their own ears after every treatment. Right? The ears are one of the more common areas of the body to bleed after a needle. And rather than me cleaning up that blood with a cotton ball, I'm going to give the person the cotton ball. They're going to clean their own ears up. We're encouraging people to clean their own ears. Give them, give a little, I got you a little cotton ball there. Do a little massage on your ears. They're practicing a little self-love, a little self-care. We're introducing people into the idea of touching their ears, right? Washing their ears, self-hygiene, right? And then they dispose of the cotton balls. So you're not even going to touch those cotton balls, right? And even if you don't see a drop of blood, give them a cotton ball after their treatment, all right? Because in a public health setting, the worst thing you want to do is have somebody leave that group and all of a sudden there's blood dripping down their jaw. It's just bad advertising. It's not going to win favor with the other nurses in the clinic that may already be suspicious of the safety of what you're doing and how much of a bother it's going to be to their world, all right? So we're going to teach people to clean their own ears and dispose of their cotton balls afterwards, even if they don't have any blood in their ear. Sometimes the bleeding can come out, can have a delayed bleed, okay? Often you see it right away, but sometimes it'll come afterwards. If you see a hematoma building up, right, you're going to have the person give that firm pressure for about 30 to 60 seconds. And that should reduce the risk of a hematoma bruising happening, okay? Another part of universal precautions that to be mindful of, alcohol swiping a point with alcohol before needling used to be clean needle technique, and now it is no longer. All right, but you're going to have alcohol as part of your kit, right? In case somebody wants their ears cleaned with alcohol, or in case there's a visibly soiled ear that looks dirty, right? Sometimes if ear seeds aren't sticking, it's because there's a lot of oil on the ear. You can clean it off with alcohol, let it dry, then put the seeds on. If you use alcohol before treatment, the needle might sting a little more in the ear. That's another thing to be aware of, okay? But the research shows is that if you use alcohol to clean the ear or skin off before putting in an acupuncture needle, actually can make that area, that surface more dirty. Okay?
Excuse me, do you use something instead of alcohol? Do you use anything to clean the surface?
The other thing I know a lot of, nurses do is use iodine, but before an acupuncture treatment, iodine wouldn't be recommended. I think washing, people washing their own ears in a sink with soap and water and drying it off, that would be another way to just clean their ear off. But it's not recommended for people to clean their ears prior to treatment unless it's obviously visibly dirty. Make sense? And you may be in a regulatory environment that requires that, in which case that's going to trump what we're talking about right here. Okay, any other questions?
The thing is, there's so much controversy or so much emphasis these days on using sanitizer that contains alcohol.
Yeah. So,
and this goes against this not using alcohol to clean the ear.
Well, we're talking about the difference between preparing a surface of the skin for an acupuncture insertion and cleaning our hands to be interacting with the rest of the world and the instruments we're working on. All right.
Mm-hmm.
So one of the universal precautions, we're always going to wash our hands before a treatment session. And then in between every treatment we're going to clean our hands with hand sanitizer. Okay? So we'll get to that in a sec, all right? Another pathogen we're going to be aware of in our universal precautions is tuberculosis, which is an airborne pathogen, okay? And you can have TB and not have any symptoms. So it's on you also, it's recommended every year to get a TB skin test to see if you have TB so you can get the appropriate care, right? You don't, it's not recommended to screen people out whether or not they have TB, but if somebody's coughing incessantly, uncontrollably, right, then they're not going to be appropriate for that group. All right. COVID-19 aside, right? That's not, they're not going to be appropriate to sit in a group because they could be infecting others with any number of pathogens. Okay. But right now in the COVID environment, nobody with a cough, we're gonna be able to provide treatment for them right now. Okay. An exception could be if you're working in a COVID-19 clinic and you've got all the PPE and you're set up to work with people who are having acute or subacute or chronic respiratory issues due to COVID-19, and you've got an environment where you can actually put those needles in, right? And you've got the safety set up. That would be the only exception. But I don't know any places in the US that are really set up to do that. So universal precautions. You know, pitch 53, it goes a lot through the NataClean needle technique. All right, how to set up the room, washing your hands. So what I want to do now is go through some of the equipment that we want to be aware of, okay? So I've sent you all a kit, right? And that's for your face-to-face practice. So you have that and you're ready wherever that is, okay? But I didn't send you hand sanitizer, right? I didn't send you cleaning equipment or cotton balls or some of the other stuff, okay? But in your kits, you should have the packets of needles only for your in face-to-face day session with the trainer. Got an ear, a plastic ear, right? Which you can start playing around with. You can practice needle technique using a pen or a tube. And I've sent you all some magnets and some seeds in a Sharps container. Okay? I got everything on a table here. We're gonna do a little review, okay? Got a little garbage can. Always make sure you have a garbage can set up, all right? You need to have that. It needs to be accessible because garbage is gonna come and go. And if you don't have a way of maintaining your table, then it's just gonna get really messy. There's a bad impression for patients when the table is just a mess. Things are disorganized, right? So every time you come back to your little table, do some reorganizing. Every day in between patients, I'm constantly reorganizing this little table area, all right? So Sharps container is going to be in the dirty field, right? Away from the other stuff, right? And over here is the clean field, okay? I'm always going to have the gloves as part of my kit, right? In case I need them at any time. So you need to carry gloves as part of your kit. Here's the needle packs. I have these also in my clinic, alcohol wipes, 70% or higher alcohol wipes, right? Because sometimes that hand sanitizer makes my hands really, really gooey. And sometimes it's helpful to have an alcohol swipe just to wipe things down and a different way to clean my hands. Because right now we're just cleaning our hands constantly, obsessively. So a lot of gunk can build up on the hand sanitizer, okay? I personally like using just 70% alcohol to clean my hands, all right? You can mix this with aloe vera, all right, to create your own hand sanitizer, okay? You want 70% or higher, okay? And if it's great if you have hand sanitizer, right? But also have alcohol. let it dry. Okay? So that's something you can use in place of hand sanitizer. So yeah, I have a little tackle box that I carry my equipment around always. Everything fits in here, including my sharps container, right? Got my cotton balls. I've got a little kit that has a little mini first aid kit. And this has some alcohol swipes. I'm ready for alcohol swipes in case I need those. You can also use cotton balls doused in alcohol. Okay. I've got some little, these are called, you can get these on Amazon, finger condoms. In case I have a little cut on my finger, I can Band-Aid it up and put the finger condom on, and I can keep needling without putting an entire glove on. If you don't have the finger condoms, you got a cut on your hand, you're gonna have to glove up, okay? And then I got a few Band-Aids in there, okay? I got my room for my seeds and all my needles there too. Keeping your equipment organized and in a hard surface container is what you want to do. So I sent you all a plastic container, right? Just to emphasize that we want to be keeping needles in an airtight container, a waterproof container as well. All right, a hard surface, because in case the needles get out of the packet, having a hard surface to contain them in is going to keep you safe, okay? And then your sharps container needs to be separated from the needles in your carrying container, okay? We don't want to mix that, okay? A sharps container gets 3/4 full, you need to empty it, okay? And the one I gave you, these little tubes, I like these because they screw on really easily. You can get other mobile, portable sharps containers out there. There's a lot on the market, but I have rarely found one that has a really good top. So I found these on Amazon, little test tubes, get a plastic biohazard sticker, and then I can actually see what's inside, you know. And in some places, they'll take a Coke bottle, take the label off, and put a sticker like this on. The important thing is that it has a screw-on lid, right? Because a lot of these sharps containers that out there on the market, they don't have a good tight lid, and the needles are popping out, and that's a very, very, that's a very unsafe, practice to have. So, Ingrid, did you have a question? Sorry, go ahead. Unmute yourself there.
There was just a lapse there, but we got it. It's okay.
Any questions? Did you miss anything I just shared there? Any questions?
I don't think so.
Okay.
Oh, I had one.
Yeah.
I just wrote mine in the chat. Let me see.
Oh, let me see. Oh, yeah. So where do you dispose of sharps? Okay.
Yes.
There are companies, right, that you can find that will actually come and pick it up, or there are companies that you can mail it into. All right, if you have a good relationship with the provider or a medical doctor or a hospital or a public health clinic, or possibly a syringe exchange program, then you can work with them to get them disposed there. Okay. What you don't want to do is just go to a syringe exchange program and dump them there. And from personal experience, I've heard complaints about that. Public health departments getting overwhelmed by AccuDetox providers, just giving them, without even asking permission, a bunch of needles to deal with. So just be mindful of the impact that your dirty needles have on your community, right? And just to take responsibility for doing that in the right way and building the right relationships and not creating a situation where the larger AccuDetox community is being seen as a problem. Or that's not going to help AccuDetox or acupuncture. Go ahead, Bonnie.
I don't know if it's the same anywhere else, but here I can take them to my local hazardous waste depot and they'll take them for me. So where they take like paint and toxic chemicals and stuff like that, I can take needles there.
Great.
But
Yeah.
depends on your community, I guess.
It's not clean needle technique to sterilize your needles. The needles come pre-sterilized. All right. And it's not safe practice to be sterilizing them anymore. They're pretty affordable compared to what they were like 20, 30 years ago when they were sterilizing needles. All right. The more you sterilize and put needles through autoclaves, the more brittle they get. All right. And it ends up taking a lot of time. Now, there may be some places around the world where sterilization procedures are necessary, but the United States and Canada and also North America, I would generalize, is not one of those. So yeah. Yeah, any other questions about the equipment? Okay, few definitions. We talked about universal precautions. We talked about clean needle technique and a few other definitions we want to just clarify. Sterile and disinfected. What's the difference between those two?
Sterile is like you could do surgery now, like very, very, very clean. Disinfected is a lower level disinfectant, lower level cleaning, right?
Yeah. So yeah, something's either sterile. Sterile is a very absolute state, right? It's airtight. The minute we open these needles up, it becomes less sterile, right? Disinfectant is something we do to our hands and surfaces of things that we come into contact, hand to instrument contact, person to person contact. Sterile is a very much more advanced process to go through, more complex, and unless it's in an airtight container, then it's not sterile. And so we're only going to use pre-sterilized, single-use only needles. Okay. Any other questions?
What about expiration date, Ryan? If the expiration date is passed and it's sterile and it's closed and it's airtight.
Yeah. There's lots of different opinions out there on that.
Yeah.
And some places in the developing world are limited to using expired needles. There's controversy about whether or not how safe that is. And I don't have the definitive answer. So yeah, but I would encourage you to use non-expired needles. Yeah. But more important than the expiration date is looking at the packet of needles and making sure there's no holes in it, making sure that the paper's not doesn't have water damage, right? Intact, it's not torn, okay? A needle's not sticking out the end. I mean, you should look at every needle pack. Is a needle sticking out? I found needle packs with needles sticking out. All the needles in that pack are not sterile, not safe. Right? Could cause problems, right? Any questions? Okay, cool. Let's take a 5-minute bathroom break. We're gonna come back. I'm gonna do a little demo on my partner and possibly my son. We'll see you in a sec, okay? Sorry, what was the question?
Just what he had missed in the first 15 minutes.
What I'd missed.
Yeah. We'll just do the recording, Pico, okay?
Oh, that's right.
Sure.
Yeah.
Thank you.
Yeah. Great. Okay, welcome. So Deanna's going to be our willing victim. So yeah, let's see. We're just going to wait for Bonnie to get back here and read up. Any other questions from first part? Stuff that didn't get answered or quick? Cool. All right. So we're gonna do a little demo treatment. Okay. What's okay. 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 Everybody see okay? Awesome. Okay, cool. So we're going to go through a few basics about the entire clean needle technique and some how do we approach patients, and I'll just show you how we needle, okay? So I already washed my hands, arrived at the clinic, hands washed, right? I would recommend 30 seconds, right? Washing your hands vigorously, all right, with an emphasis on rubbing your hands. That plays a role in cleaning your hands as well, with antibacterial soap and a neutral temperature water. Okay, not too cold because then your hands are going to be cold, and not too hot because that will dry out your hands. Okay, get to the clinic. First thing, I'm going to clean my hands with my hand sanitizer, with my homemade 70% isopropyl alcohol hand sanitizer. Okay, or you can use your your other type of hand sanitizer too with the gel. All right, you know, anytime I forget what I'm doing, I'm in the clinic, I got a little distracted, a little focused, I'm not sure where to go next, or I'm not sure which patient to treat next, or I accidentally, you know, pull my hair back to make myself look slick. I've just soiled my hands. We're gonna go back and we're gonna wash the hands again, okay? So when in doubt, right? Clean your hands, right? Another thing you can do when you're in a busy group and maybe you're getting a little flustered is just to come back to your table and organize stuff. Put stuff into the place. The patients, you give the appearance to the patients that you know what you're doing. You're getting organized, right? Taking some deep breaths, try some box breathing. Breathe in 4 breaths, hold 4 breaths, breathe out 4 breaths, hold 4 breaths, breathe in 4 breaths. Box breathing is a great way to cycle through when you're doing NADA, okay? Because you're not just treating one person, you're treating a whole bunch of people at the same time. So we're going to be mindful of everybody we're treating, okay? So when we approach the way Lincoln taught to do NADA, and this is kind of the NADA, has been the NADA standard, is to approach at a 45-degree angle from the patient. Not right in front. This is uncomfortable, right? And not too far away, right? But about right here. Not too close, right? So this is too close, right? We don't want to touch that person at all, really, particularly right now. The only thing that's going to touch the patient is the needle, and possibly if you're using the guide tube, the tube, right? That's it, all right? It's always been recommended not to approach people from the back, okay? Can everybody hear me from talking from back there? I'm coming in clear? Okay, cool. Not to approach people from the back, right? Because, you know, that could be traumatizing to the person, right? That could frighten them, okay? I would recommend in the COVID-19 environment, approaching more from the side and staying out of their facial area to reduce the risk of air droplets landing on you, okay? So yeah, now in the COVID-19 environment, I'm gonna have a mask. They're gonna have a mask. Ideally, I would have a face shield. All right, I'm gonna send you some product links on Amazon that you can purchase face shields if you don't have one. Okay, some places it's recommended. In some places it's mandatory. You have to look at your local regulations. Right, it's always going to be safer if you have that face shield on. Okay, because that's going to minimize how many air droplets are hitting you. So approaching from the side is a safe approach that I would recommend right now. And now her hair is in the way of her ear, but I'm not going to touch the hair to move it back. All right, even though she's my partner, right? If she were in a clinic, I'm not going to touch her hair. Even if she were my partner, I'm going to treat everybody the same. That's another important thing, okay? But I'm going to ask her to move her hair back. So yeah, sometimes you may have some hair ties as part of your equipment. It's a good thing to have for women to pull their hair back, because you want the ear to be right in front of you, okay? You want to be able to see the points. Even if the hair strand needs to be pulled back, just have her do that. Have her touch her own hair and her own head, okay? Now what I can do is have her move her head to different positions to get to it, okay? To get to the right point. So I can have her move her head to the side, front, or the back, okay? And you can just give them that type of direction, okay? That's gonna be a lot of your verbal interaction with them, is asking them to move their body, to reposition their head and their body. If I'm too far away, then I can ask her, ¿puedes mover hacia la frente de la silla? You can have them move to the front of the seat. No, está bien. Puedes sentar en el frente de la silla. You can have her move to the front of the seat while you're needling, and after I put the needle in, then I can have her relax back, okay? But we don't want to be like bending our back, all right? Like this, getting to the right place, or hunched over, because that's just going to hurt our back. And we're not going to be as confident and solid in our technique. Our hands can get a little shaky, and it just looks like we don't quite know what we're doing, all right? So I want to keep my back straight, right, upright, and I'm going to use my knees to bend like this to get to the right place, okay? None of this, all right? Spoken from somebody personally, I've hurt my back a lot doing so much repetitive group acupuncture, because it's a lot of bending over. So learning how to engage your core when you're doing this work, you know, strengthening your core muscles, all that's going to help you to be able to do this long term and protect your back through all of it, okay? So when I'm here, I'm grasping the pelvic floor as I'm needling, okay? So I'm going to go ahead and take all the needles out here, right? And ¿puedes mover tu pelo detrás? Okay. And okay. Move to the other side. Okay. And that was using the tube, okay? You'll learn, in my class, I teach learning how to use the tube and how to freehand as well, okay? End of the session. Right. Well, after I treat her, before I move on, to the next patient. I'm gonna come back, clean my hands, all right, before I move on. So yeah. Go to the next patient, treat everybody. And then at the end, I'm gonna grab my sharps container. All right, take the cap off. And I'm gonna grab cotton balls, okay? You can give them 1 or 2 cotton balls. If you're running low on cotton balls, you can give them 1. They can use the same cotton ball to clean both sides. Esto es para limpiar tus orejas. That's to clean your ears off. Después te quito las agujas, okay? So 1 by 1, and I'm gonna bring my sharps container right to the ear to pull them out so I can just drop them right in, okay? I'm not gonna be going back and forth and dropping every needle back and forth. You want a mobile container that you can bring right to the person. This is gonna minimize the risk of you sticking yourself with a needle. Let's limpiar tu oreja. Y el otro lado. Go ahead and clean both your ears out. Great. And then trash can, a great place for the trash can is actually right in the middle of the room. So patients, after they clean their ears out, they can go drop the cotton balls in there. Now, with my garbage can full of blood-stained cotton balls, I'm gonna bag those up and dispose of them after each session. I'm not gonna leave those spotty cotton balls for my colleagues in the group counseling session that's going on next. All right, so clean your stuff up, right? Then I'm done there. I'm gonna go ahead and clean my hands off. Okay. There we go. Any questions?
Is there ever a time where you're more stationary, like if you had a specific chair that everybody came and they sat on and you just did the needles there and then they moved from there over to a different chair? Does that ever take place?
It's not recommended. It's recommended get everybody a comfortable chair and have them get settled in. You want to have them get settled into the place where they're going to be able to relax to the fullest and maybe even drift off into a nap before you get them needled, okay? So
you're the one being mobile rather than...
up, you can have them laying down, they can sit on the floor, anywhere where they can rest. It's not recommended to stand up or move around. So if people want to stand up and move around or go to the bathroom, it's your responsibility to take those needles out before then, okay? Sending them with the needles to the bathroom, those needles could drop on the floor, and now you've got an occupational hazard. All right? Any other questions?
I have a question. Do you say anything about you could close your eyes or leave them open or anything about how they are?
Yeah.
When they're with the treatment?
We'll dive more into that later.
Okay.
But you can encourage people to close their eyes. But some people closing their eyes may not be a safe thing for them to do. Particularly people with a history of trauma cannot feel comfortable closing their eyes. So if somebody comes back with the feedback, like if somebody, I notice their eyes are just wide open through the whole treatment, right? And they report to you, I'm having trouble relaxing. You might recommend, why don't you try just closing your eyes and taking some deep breaths after I put the needles in, right? And that can really help them to ease into that nap. But some people are just gonna feel more safer with their eyes open, right? So now we talked about coming in from the back, right? Now we're gonna be treating people 6 to 8 feet apart. So there's gonna be a lot of room between people. I would recommend whatever space you have, people have as far apart in the room as possible. Even if that's 10, if you can get 10 feet birth, do it, right?
Mhm.
Get a lot of space. And then even though before with clean needle technique, we try to go around from the front. In some settings, it may be better to give a wider berth when you're going around people. Anytime you're interfacing with their face, it's just more risk you're bringing yourself into. And it's recommended with NATA clean needle technique for COVID-19 times. Also, it's recommended to not sit too close to any of the patients for extended periods of time, even to sit on the outside of the room. You can observe and see them, but to give them a whole lot of space, right? It could be even safer to have people face away from each other. As sad as that is, and as much as that can impede the group experience, minimizing risk for them to each other, having them face away, you know? So we've been trying to do group NATA in parking lots with people sitting in their cars. It's actually been a great way to just have people just stay in their own space, or have them bring a recliner and then they sit in a parking lot as the sun sets, and it can be a nice experience. They bring a little lounge chair. So they can even sit on the curb. So the purpose is to give people space. The more bigger the space is, the better. If it's outside under a tent, even better right now. Okay, these are all just little things you can do to reduce your risk. Okay?
Are you having patients wear a mask?
Yes, patients have to wear masks.
Okay.
So I would recommend having also part of your equipment, a box of masks, because you got to tell people to bring a mask, right? And some people are gonna come without a mask. So if you can get some surgical masks, you know, that will be a great service to that person. And then you're sending them home with something that they're gonna prevent. They've got more equipment to be safer in the world, which helps your whole community too. So yeah, any other questions about how we approach people and the steps that I just went through? And there's a whole lot of other stuff about doing groups. We're going to cover a lot of that today, but specifically about how I worked with this person.
Okay, what about if a needle drops or a needle count? How do you manage a needle count? How do you
Yeah.
control?
So we're going to go more into that later, in depth that later, but a general rule, if it falls on the front of her chest down to her knees and the needle is there, I'm not going to take it off of her. I'm going to have her grab the needle and put it directly in the sharps container. I'm not going to ever take a needle from the person, but I'm not going to ever touch that part of their body, okay? If it falls on the back of their shoulder, right? Like right there, that's a little easier to do. If it fall into her hair and disappeared, I'm gonna wait till after the session. I'm gonna have her comb out her hair and it'll probably fall down to the floor. Okay? So yeah. Any questions about working with this person? We'll talk a little bit more about fallen needles later. Any questions about how I work and the steps to go through? Okay, cool. Thank you. All right. So on the YouTube channel, I think if you've never worked in a NATA setting or a group acupuncture setting, right? Then hold on a second. I'm going to put my earphones on right now, so you can hear me a little bit better. All right.
Everybody hear me? Okay. Great. So on the YouTube channel, there are some videos of I'm going to just put the entire YouTube channel in the chat. There's a lot of videos there about that show some clinics in Juarez, that we've worked in where you can see what the group treatment is like. And you can also, there's also a lot of other types of YouTube videos that you can find about seeing what it's like. But the best way to get a good grasp of it, as we've talked a lot about in these trainings, is to get a lot of treatments yourself. All right. So as soon as things start to open up, you know, and you feel safe going out into the community and getting acupuncture, going to either a NATA group or a community acupuncture clinic like where Sierra works at, okay? That, so maybe you're an acupuncturist, you've got a lot of experience. If you've never seen acupuncture in a group setting, even just a community acupuncture clinic would be great. It's gonna help you to understand what that's like, okay? Because it's very different than how a lot of acupuncturists, how I was trained in an acupuncture school, particularly. Most acupuncture education is designed for the one-on-one setting, and doing group is a whole different beast. So, all right. So, so let's wrap up fallen needles. You know, just kind of dovetailing off that, just to kind of get this little chunk out of the way. So, so fallen needles, we already talked about what areas of the body are appropriate to get the needle and when the person needs to get it themselves. One thing that happens is the needle might fall right here. Can you all hear me? Did you lose me there?
It's a little choppy.
Okay, let me give me 1 second. Let's just pause this. I want to move over to my hotspot phone and see if we can get better reception there. So sorry about that. Hang tight. All right, can you hear me now? Okay, I moved over to another network. Let's try this out. Will you all just interrupt me if I'm not coming through well? Cool. Then we'll restart. So fallen needles. Okay, let's say during the treatment a needle falls right there. Common thing. I'm not going to go grab that needle. All right. Ideally, I'm going to wait till the end of the session and have that person take it off there or stand up, and that will fall to the ground, and then we'll sweep all the needles up at the end of the day. Okay. But as long as a person's not distracted by that needle that fell on their thigh or their chest, right? We're gonna let it go to the end of the time. But if they're like really distracted, it's just like bothering, it's interrupting their treatment, what you can go over is just take your needle container, right? Hey, can you go ahead and grab that needle and just put that right in here? Boom, taken care of, okay? If you are stressed out over every single fallen needle that happens during the treatment, that's going to impact the group. All right. The importance is that you're responding calmly and confidently to the situation. This people are looking at you. People are watching you while you're doing this treatment. You got a room full of people watching you, right? And you're the expert. So how you respond is going to impact their entire experience. So be mindful of that, okay? Avoid words like oops or oh, shoot. Oh my gosh, I messed that one up. Oh my gosh, you just, those types of things are just not necessary. This is a nonverbal experience. Everything you say and those little gestures going to impact the confidence that person has in you, okay? Fallen needles, sometimes needles can fall inside people's shirts. Okay, it's happened before. It's not the end of the world. You're not going to go to jail. It's how you respond to it. All right. If you just are like, oh, I hope that never shows up again, that's not going to help. All right. So what you want to do is what you can do is send them to a private room and have them take their clothes off, or send them to the bathroom if necessary to have them fish it out. Okay. People, if they find a needle, you know, you want to have them put in a sharps container, not the garbage can. It's another thing to be mindful of. You're responsible for collecting all the needles that you put in. So some clinics have a needle count. They have little sticky marks, sticky Post-its. What are the sticky pads? I forget the right word. Anyways, they have those. They stick that to the person's chair, how many needles they put in, because some people might only want one needle. So you make sure you get that many needles when you remove the needles. Okay. So different organizations may have different rules around counting needles and collecting them. Okay. But a common practice is like a hardwood floor is really good to have needles, because if they fall on the carpet, it's harder to find them. But if you have a hardwood floor, that's really great. And then at the end of the session, you're going to clean everything up. Have a broom and just sweep everything up instead of going around and analyzing every inch of the floor for needles. Right? You can also get magnets. Right? This here is a magnet. You know, you can get things like this on Amazon. When I was training at Lincoln in the South Bronx, I was one of the things we were constantly doing was we were going around and raking the entire room while the patients are getting treated, raking up all the fallen needles. So you need a system for doing this, okay? Any other questions about fallen needles? Okay, hang on real quick. I need to take a quick pause, okay?
We need some coffee, Kelsey. It's very interesting, but I do get sleepy.
All right.
Okay.
Questions about fallen needles?
How common is it?
Gosh, I don't have a percentage on that. It really depends on how good you get the needle in. At the start, your confidence is going to need some work until the needles are going to stick in fully. When you first start needling, the needles are going to be dangling and they're going to easily fall out. Okay. So yeah, but if you get your confidence up, you get a lot of practice in, you know, really ideally they shouldn't fall out. Okay. Any other questions about fallen needles? Cool. All right. Well, let's do a little demo, and then we'll get a practice with a tube. So, what I'm going to do is show you how to open up a pack of needles. Okay. We're gonna learn how to practice with a little guide tube, both a freehand and then a tapping using the tube technique. Okay. So, and there are a lot of really detailed instructional videos on our YouTube channel about some of the stuff we're going to go through. So that might be helpful to look over those as well. Okay. And so yeah, and I'm only able to allow you to practice needling on the plastic ear if you're a licensed acupuncturist and it's part of your scope of practice. Okay. But the rest of you can, with a little guide tube, you can pull that out. But let's just go ahead and show how this little needle packet. Okay. I'm going to have the paper side towards me, right? I'm going to peel back the paper until I can just start to see about a ½ inch of the needles. Now I'm going to pull back the plastic side behind, and I'm going to grab at a perpendicular angle with the vertical axis of the packet so that the tube and the needles are sticking out. So I've got the plastic side behind and the paper side in front, okay? And now I can take the little guide tube out, okay?
Mhm.
And I can kind of tuck it into these fingers right there just to put it on the side while I get the needles out. Now, holding the needles and doing efficient, confident needling, I'm going to really encourage you to focus on the angles that you're holding your fingers and the angles that you're holding your needles. And I want to try to keep it at perpendicular angles. It's going to really help your confidence. It's going to help with pain, your gentle technique. Okay. So here we are. We got these, you know, this horizontal axis that my thumb and finger are on, and then the needles on the vertical axis. Okay. Now I'm going to take this and I'm going to grab all the needles upside down and pull all 10 of them out at the same time. So they are facing with the sharp end up. Everybody see that? Now I'm going to put this packet aside, extending the plastic, the flat plastic part down, so that at a later point I can tuck those needles into bed. So I'm going to put this right down on my clean field, right? Put the needles back down on my clean field table. And now I've got this little guide tube there. I've got all the needles lined up. Okay. And right now the needles are in my dominant hand. I want to switch the needles over to my non-dominant hand before I needle. All right. So is everybody here right-handed or are people here left-handed? You left-handers? All right-handed? Okay. So you're just going to mimic what I'm doing then. So so we've got the needles face the sharp side up. My fingers and the pads of my fingers can kind of roll and feel those needles. And a good thing to do to practice, you know, once you get going and once you're able to actually practice needling, your confidence up is when you're watching Netflix or movies, or just to kind of just to practice doing this. So you get comfortable, so it's not too tight and hurting your hands and causing your hands to cramp. And it's not too loose that the needles are following. So it's that nice middle ground there, okay? And then I got my tube over here. So I can put, I can, and practice moving the tube, and you can take your tube out if you want, and you can kind of toss it around like a little baton between all your fingers. And that's a great way to practice, you know, maneuvering needles and maneuvering the tube. So if you got the tube, I'm welcome to open that tube up, that packet, pull that tube out, and we can just practice moving this tube. We're going to need some sort of instrument to practice as if this were a needle. So if you can also use a toothpick. But if you've got your needle packs there, go ahead and take this little guide tube out. Okay. And if you don't have your needle packs there, I want you to grab a pen. You need something. Thin instrument like this. All right, go ahead and grab that. Bonnie just had asked in the chat, I just saw the chat, sorry, the length of needles we're using. We're using 1/2-inch needles or 1/4-inch needles for the ears. Okay. So it's going to be 0.15 millimeters or 0.13 millimeters for the length. Okay. The gauge I would recommend is 36 gauge to start out. All right. And then as your confidence builds up, you can move to thinner needles, which may be less painful. But starting out, I'd recommend 36, maybe 34. The more you get into 34, 32, it's going to hurt a lot more with insertion. So 36 is a nice middle ground where the needles stick good enough. And then Retta, I will check with Savannah about what happened with your kit. Okay? Yeah. Okay. So, so I've got my needles right there. If you're a licensed acupuncturist, and you can hold on to the needles. If not, you're just gonna have to use the tube to practice, okay? But what I wanna do now is transfer the needles over to my left hand. Okay? My non-dominant hand, and my tube over to the right hand. And then we're gonna keep at these angles, right? Right there. Now with the right hand, or my dominant hand, I'm gonna hold the tube with my thumb and my middle finger. And over the top of the tube, I'm gonna have my index finger. So everybody put your little instrument up like this. I wanna see your hand position. Okay, you wanna hold this at an angle, not like that, not like that, all right? We wanna hold it at an angle right there. All right, and just kind of tap on the top of that tube. Just a swift tap, okay? This is not gonna hurt. Swift rebound, like a basketball bouncing back up, okay? This is gonna hurt. Pressing it in, or all right? Or this is gonna hurt too. That's gonna hurt. We wanna be with the light part of the pad of our finger. Swift tap, rebound, okay? Not too hard, not too soft. Okay? And so let me see everybody there. I want to get this technique down. This is something you can practice. This is really going to help your gentle technique. If you want to be a gentle needler, you want to avoid your patients accusing you of acutorture, get this technique down. Okay? Great. And I want to keep that angle there, okay? So it may feel awkward on your forearm, on your fingers. You may need to develop some flexibility, do some finger yoga exercises to get your fingers into shape, all right? Because if you're having trouble holding on to this, then it just means you need to practice. You need to get some flexibility, you need to get some new strength into that area, okay? Rita, I can't see your, can you put your, great, okay. So swift tap, rebound, just boom, all right? The swifter and faster you get it in, less pain. The slower, pushier you get, it's just like, that's when it's gonna hurt. Okay. Great, so this is the technique. So I'm gonna practice on my little forearm there, okay? What I'm gonna do is cover the tube with the top of my finger, so you can do that, and we're gonna turn upside down. So go ahead and do that. Cover the tube with your index finger on the top.
There you
Okay.
are.
Did you lose me?
We lost you for a
Yeah.
while.
Better now?
Okay.
Where do we last pick up? What was the last thing you heard me say?
The tap on the tube, I think.
Okay. All right, so we got our middle finger and our thumb holding the tube. We got our index finger over the top of the tube. Okay, turn that upside down. And now we're ready to load the needles in. Okay, load it in. Now I can see the pokey side out. We're gonna back that up, and we're gonna grab the back of the needle with an index finger there, okay? And tap it in, just a swift tap, okay? So after you go through your face-to-face and you're able to start practicing, this is a good exercise you can just sit around and do every night. All right, the forearm there is a great place to practice. All right, it's a nice meaty part of the arm. All right, doesn't hurt to needle that area, and just getting that repetition down. Okay. Any questions?
me see.
And like I said, a lot of our YouTube videos, once you're able to start needling, you can reference those to go through some of these same things, okay? But that the transfer of needles, the handling of the needles, the taking them out of the packs, getting them back and forth in your fingers without having to stress about every movement,
We
that's
lost you.
okay. Sorry. What was the last thing you heard me all say?
Transferring the needles. Go back
Okay.
to the beginning of transferring the needles.
So the transfer of the needles, the holding on to the needles, the hand position, how fastly and confidently you can do that without thinking about it, without having to stress about every little step along the way. That's the key to being able to needle in a group setting, lots of people at once, confidently and effectively. Okay? The more you're fumbling, if you're fumbling around with the needles, just holding on to them, then you're not ready to really needle in a group setting. It needs to be, so that's going to be a hard thing for you all and your progress for some of you because there's going to be delay in this class when you can actually start needling. So it's going to be on you to, once you can start practicing, to get a lot of practice in every day, practicing every day, okay? But needles aside, let's go back to your little tube or your little device. You can take a toothpick or a pen even, right? And so this is the tubing technique, right? And you're going to back it in from upside down, one by one. Okay? The tubing technique is going to reduce pain. It's going to be more gentler. The needles are going to stick a little better. Okay? But you're only going to be able to use that tube for one patient at a time. You can't reuse that needle for the next patient. Okay? So let's, you all still with me?
Yeah.
Okay, so let's go on to the freehand technique, okay? The freehand technique, take the same tube, and with the freehand technique, we're gonna hold it with our index finger and our thumb. All right? And I wanna hold it again with the pads of the finger. The pads of our fingertips are the softest, gentlest, most sensitive part of our hand. So we wanna use that. We want it to be touching flatly those parts. Now the needle is really going to be, we want it to kind of come out of the center, the palm of our hand. So it's going to be in one line. Okay, I don't want to be needling going out to the side like that. We want it to be in one line to go directly to the point. Okay, and the technique is skin and spin. Okay, so and the swifter and the faster you get it in, more effective, the gentler it's going to be. If you slowly press it in and you're tentative, it's going to hurt. It's going to hurt. And you can try this. Practicing on your own arm, practicing on your own ear once you get going is a great way just to get your confidence up, right? Just to get that repetition down, and you can see what it feels like. Try a technique. Ow, that hurt. Okay, what did you do? You know, and going back to these basic fundamentals will keep you on track. So yeah, so what I want you to do with your little device is grab your arm, and I want to see your technique right there. Now that we're going to be spinning to the right, it's skin and spin, okay? And I just want to see this repetitive motion. Hold it up to the screen there so I can see. Okay. And make sure it's in one line with your fingers. Not like that. We're not putting in needles like that. We're going straight in.
Oh, okay.
Okay? It's going to have to be in one line, or it's going to hurt. Okay?
Okay.
And we're going to be turning clockwise to the right. If you're left-handed, counterclockwise to the left. Okay? So yeah, so those are some basic technique things that you can come back around to. as you start to practice. Okay, and if you're an acupuncturist and you want to get your group skill sets up, being able to do group acupuncture in general or group ear acupuncture, NADA, I would just practice doing that over and over again, you know? So yeah. Any questions about those basic techniques, those basic fundamentals?
It just feels a little awkward because my thumb is basically as big as that that tube is.
Yeah.
Width-wise and everything, so I got big hands, so it's just feels a little awkward.
Yeah. Well, like, Dr. Michael Smith, co-founder of NADA, he had very big hands, and so it's just might be a little bit building some flexibility. I would recommend doing some daily exercises on hand yoga exercises, right? And just getting that repetitive motion over and over. You'll be able to get there. So yeah, go ahead, Bonnie.
Do you ever suggest, we used to do in acupuncture school, like apples and oranges to get the idea of like actually piercing something that's close to human skin?
Yeah, that's a great thing to have, I got a little orange right here. And actually one of the videos I have on our YouTube channel is just how to practice on orange. Orange is much better than an apple because the skin's a lot more mimics like a human skin. So you want to you find a fruit that has the toughest skin. That's what you want to practice needling into. If you're just going into like a blueberry or a strawberry, it's just like going into butter, So yeah. Any other questions about this technique?
I'm used to using the seeds, and I use the other hand to put the ear into position. You have, and this is one-handed, I'm noticing.
Yeah.
And do you have any trouble finding the points when you can't, and when you're standing up straight, seeing where you're going?
Well,
don't manipulate the ear?
Yeah, a more well-lit setting is always ideal for NADA, at least during the insertion. Sometimes people will turn the lights on they go around and needle everybody, then they'll dim the lights after they get the needles in. Some providers have little flashlights. But I would recommend you get to the point where you know the points so well, right? That you're less dependent on having the light to find the right point. Using the guide tube can help you to get to that point with minimal light settings. Okay. And it's also going to be a matter of your ability to guide that person in moving their head. Can you tilt your head back? Right? Doing that so you can see and get to the right place. But we're not going to be touching that person's ears when we're doing NADA. We're not going to grab behind their ear. If you hold the ear behind their ear, there's a risk you're going to get needled yourself. The needle can actually go through the ear and poke you. Okay. It's also just too invasive. We're a very super minimalist approach. This is the most minimalist approach to doing acupuncture because of the settings we're in. We're in public health settings. We're in group settings, right? We're working with people that, as we talked about on Wednesday, most people with addictions problems have a history of trauma. So we're assuming most people have some sort of traumatic experience, right? And also the idea of touching somebody's ear, holding onto that ear to needle, it's just one more risk of infection, one more point of contact. We're dirtying our ears, right? So, and especially now with COVID-19, your nimble ability to get in there with the least amount of contact is real critical to your safety and having a safe group space. And so it's even more of like a stealth. Like even when you're talking to people, you want to be 6 feet back. You just want to go in right at the last moment and get those needles in. So, and it takes some practice to have the right presence in that setting. So it's not uncomfortable for that person. If you're feeling uncomfortable talking to somebody 6 feet apart, Might want to, you know, have some social distancing parties at your house and practice it. So you get comfortable talking with people 6 feet apart, right?
That's a good idea.
And that can be hard right now because we've been indoors and we're all, there's this paranoia about being around others, you know, and if you're not comfortable in a group setting with other people right now, then that's going to come across. So yeah, just, you know, doing, so anyways, yeah, I won't go on about that, but I could say quite a bit on that little piece, but did that answer your question, Ingrid?
Yes. Another question is that, well, I suppose when you get to the points, you'll talk about that. I'll wait.
Yeah, we're going to get to point location in just a sec. You had some question about point location.
Touching on the way in, if you're, one of the points was the sympathetic point to, if someone has a really heavy helix, to slip under from above and come to it from above.
There's different angles you can actually get to the point.
Yeah. But then when you talk to the points, you'll get to that.
Yeah, I think, but getting, you know, using the guide tube to guide to get to the right point is going to be critical with all the points, because you can maneuver it, get it in, then you can actually tilt the ear partially with the tube and then tap it in.
Okay.
Okay.
I'm thinking of the needle and sterile technique, but I'll figure that out. I hear you.
It's going to be hard in this Zoom format to show you every angle to go in from every needle.
Yeah, yeah.
And that's going to really come in when you get your one-on-one. So I think the best practice you can do in the meantime is getting used to this tube. If you're licensed acupuncture, you can keep just what I just showed you, getting that down. So your mind is not busy worrying about these little details.
Okay.
All right. It makes sense? I can't overemphasize that enough. You know, and you've got two techniques. The freehand is something you got to be able to do. The guide tube, using the guide tube is a little bit more of an kind of advanced technique. I find it helpful to teach new students that. I get feedback that it really helps their confidence, helps the needles to stick in better, helps with gentle technique. But you may be working with a teacher that's only teaching the freehand. So be aware of that too. Okay.
And the freehand, we were practicing with the guide tubes right now, but I presume the freehand is the needle, just the straight needle.
Yeah, freehand means just, yeah.
Needle.
So we're imagining this is the actual needle going in. Yep.
Okay.
Good question. Okay. Yeah, Ingrid. Yeah.
And yeah, the obvious sometimes escapes. I forget what I was going to ask. It'll come up in a minute.
Okay, cool. Well, you all ready to go on to learn some of where the points are?
I was going to ask Ryan if we'll have access to this recording.
Yeah, you will.
Now, I went to look up the other recordings, and they all had, what, $25 or what next to it. Do we just go in and...
Okay.
How do we do the recordings?
Yeah, let me talk with Savannah about about getting you the coupon code to that. Okay.
Okay, excellent. That administrative, just send an email or something.
Yeah. Okay, cool.
Thank you.
Yeah. All right, you want to learn some point location? Okay. Why don't we take about a 5-minute break? We'll come back and do that. I'll get things set up, okay? Or we can get a little break, a little stretch, a little fresh air, a little water, run to the bathroom. See you in a sec, okay? All right, everybody there? Okay, cool. Just unmute yourself if you have questions along the way. As I do screen shares, it's harder for me to keep track of your faces. So, and raised hands. Can everybody see the screen here with the upside down uterus, upside down fetus, I mean. So there's a lot of different systems of auricular therapy, different types of protocols, different schools, and this is an inverted fetus, which is a model kind of developed by Dr. Paul Nogier, who's did a lot of the development for auricular therapy, out of which the NADA-points were developed, using this model of understanding the ear as a microcosm, a microsystem of the entire body, like a reflexology, point of entry to helping people heal. So there's a lot of different points, and your scope of practice, if you're not a licensed acupuncturist, will just, in the United States and Canada, will just be limited to the NADA point. So these are the different anatomical areas of the ear, right? How Western medicine sees the ear. Can you see the mouse cursor? Okay, cool, great. Oh, awesome. So we got this top area, the triangular fossa. That's the first anatomical area we want you to be familiar with. And you can take out your model ear there and follow along with a little tube or a little toothpick or a little pen. Okay? So you can kind of get comfortable probing around. Now this inferior antihelix crus, this ledge here, kind of drifts off into this. There's a underneath the helix there, along the at the end of the inferior antihelix crus is where the sympathetic point is over there. You're often not going to see the sympathetic point. Shenmen point is going to be right there. In the cymbium concha, this bottom area, right underneath the Shenmen is going to be the kidney point. The edge of the concha ridge is going to be the liver point, and in the cavum concha, the deepest part of the ear, is where you're going to find the lung point. So those are the 5 NADA points, okay? So yeah, let's go on to this. There they are. Can everybody see the ear okay? Okay, great. Cool, so there's all the 5 NADA points. And the Shenmen is right above the kidney, which is right above the lung point. So there's kind of like an axis there. And then so it almost kind of forms a cross. All right, there's no religious significance here. Even though I do acupuncture in Catholic churches, there's no religious significance of this cross there. We don't need to read too much into that. But it helps us to kind of like the directions, the axis mundi. We also understand the ear as a reflection of ourselves and the universe. So it's like a connection with the outer world. We talked about on Wednesday's class how the ear is the orifice of the kidneys. And if you look at the ear, the shape of it is actually in the form of kidneys. A lot of the points in acupuncture were developed by looking at what part of the body looks like the part of the body that we want to treat. So we're trying to tonify the kidneys with NADA points. And to tonify the kidneys, we're going to use this organ, the ear, that looks like a kidney. Right?
A quick question.
Mm-hmm.
That number 3 point, which one is that?
Kidney. There you go.
Kidney.
Yeah.
Kidney. And is that on the little edge there, or is it like right under that?
It's just kind of underneath that ledge, so it's partially hidden.
Okay.
Yeah. Now, you'll notice there's parts of the ear that are more shaded and dark. And then like this point, number 1, sympathetic, you don't even see. It's completely dark. This triangular fossa area is, oh gosh, where did we go? Is a little bit darker, shaded. The cymba concha and the cavum concha are all darker areas. So All of the nada points are in darker areas of the ear. There's also lighter areas of the ear. Those are the yang parts of the ear. All right? The nada points are all yin points. So we're building kidney yin. Remember we talked about that on Wednesday, tonifying kidney yin. All right? So this Shen Men point is kind of on the border of this. There's the upper ridge of the triangular fossa, and then there's the bottom part of it, and you can see it almost. You can put your finger, your pinky finger should fit right into that little triangular fossa. You can try doing it on yourself right now, and it's going to be right below the top border of that. So it's not up here on the yang part on the ridge. It's going to be just off of that. And another way of understanding this triangular fossa point, this Shen Men point, is that imagine this is a fish and this is the eye of the fish, right? So yeah. The lung point is going to be the deepest part in there. Right in the middle of that area is the heart point. And then above and below are the two lung points. All right. But if you look at the bottom part of that ear on somebody's ear, you should see a little shiny glimmering reflecting off of the sun or the light in the room. And that's where you want to go. Now, these points are not like pinpoint microscopic. If you're not in that one microscopic point, you miss the effectiveness or you miss the point. These are general areas. Okay? The liver point's going to be all the way at the end of this line, right? This line that goes from the outside of the ear and then goes inward, a little labyrinth. It's going to be at the end of that line. Now, some people's lines there are going to stop right there. Others are going to stop right there. Others are going to go all the way over to the edge. You want to go all the way to the edge. Now, we're not on top of the ridge over there on that yang part. We're in the inner part. So it's kind of these 3 points, the kidney, liver, and lung are all in on the floor of the concha area. Okay. And so what I want you to do is I'm going to take off this screen share because it takes up so much of our screen. I want to be able to help you all find with some sort of instrument, the guide tube, or a pencil or a toothpick with your model ear. Find these points yourself. So here we go. We've got sympathetic, got Shen Men, kidney, liver, and then the lung parts point. There's the lung point. Okay, so if you've got your model ear, go ahead and show me the different points. Let's see if you can find them.
Do you want us all to go at once, all doing all the points?
Let's actually do. Let's do one at a time. One of you, we can each kind of show off here. Go ahead, Takoa.
Sympathetic. Right in here.
Good job.
Shen Men.
Okay.
Up here. Kidney here.
Okay.
Underneath.
Yep.
Liver here.
Yep.
Lung here.
Good job. And it's hard for me to give really great feedback through the Zoom because things are a little blurry, but good job though. Great, Kelsey.
Oh, okay. Let's see. I think. Okay, wait. The first one is the. I don't have anything in front of me. I can't remember what they are.
Sympathetic. Yeah.
But I know that's one. Yeah, sympathetic. Can you see?
All right.
Like
So we're gonna go. What I want you to do is, you see this ridge there. We're gonna go on the bottom ridge of the triangular fossa all the way over.
Okay.
Not up on the top.
Right.
Better,
Not in that
yeah.
corner.
Better, yeah.
Okay. And then Shen Men's right under here, I think.
That's
right under
kidney. That's
Oh,
kidney.
that's kidney.
Shenmen's going to
Oh,
be above it.
Shenmen's
in
up
the-
there. Right there.
Good job.
Is that
Perfect.
more?
Yep.
Okay. Then kidney down there. I should. Right.
Okay,
And
great.
then over here is the liver. that
Okay.
right?
Yep.
And then the lung is down there. Somewhere at the bottom.
Good job.
Kidney, liver, lung.
Yeah,
thought it
Bonnie, you want to show
on
us?
my phone.
Okay, great.
So that's the best I could come up with. Can you
Okay,
see?
good.
It's hard to see both.
Yeah.
So Shenmen can sort of in there.
Uh-huh.
Oh, it's on. Come back. Sympathetic would be up inside
Mm-hmm.
along that ridge. I
Mhm.
can't get in there. Oh, it's small again. Kidney just underneath here.
Uh-huh.
And what else? Liver at the end of
Yeah.
there. And lung down in the hollow. Am I there?
Okay, great. Good deal. Good deal. And no, you, Ingrid, you and Rita don't have an ear with you. Oh, do you have a practice ear with you, Ingrid? Oh, you do. Great. Okay, cool.
Has the answers on it, but they're in Chinese, so it doesn't count. Shenmen is up here. Whoop. Up here.
Move it over towards you. Move the ear right over. There you go. Perfect.
Coming out of vision. Shenmen is up here.
Okay.
Kidney is under there. Whoops.
Mm-hmm.
Liver.
Yep.
There at the end. Lung.
Yep.
You can see, you gotta see around corners, can't you?
Good job.
And sympathetic is down there.
Yep. Good job. So why don't we go ahead and why don't we go ahead and try finding this with our fingers? And so go back to our ears, and you know the pinky's a good little instrument to get into these points. So see if you can find that sympathetic point. You almost have to kind of pull back parts of your ear to get to it. All right. If you're not sure, go ahead and try to hold your ear up to the screen. I'll do my best to guide you. Great. All right, now let's try the Shenmen. Your pinky should fit right into the notch of the triangular fossa area. All right. Good job, Takoa.
There it is.
And then so if we drop right below that Shenmen point into this area, the Simba concha area, we can find the kidney point, right? It's right underneath, directly below Shenmen. Okay?
Mm-hmm.
And then we just move over, follow that ridge, and you should find liver point at the intersection of the little, like it's like a little C, edge of that C, or the half moon, where that intersects with the line coming down from the helix, extending down from the helix, okay? And then the deepest part is going to be that lung point. Should be kind of a round, soft space at the bottom of the ear, with kind of a large area around there. If you're not sure, go ahead and hold your ear up, and I'll try to help you with any one of the points. Good job.
Pretty clear.
It's nice because it feels like you can actually feel a little point, like when you get it right, you know. I don't know, it feels like there's a
Yeah.
sensation that comes, like feels like a point.
Does any of the points feel different
Yeah.
than the other ones? Any observations?
My liver one does feel kind of hurts.
A little
Yeah.
sore? Okay.
Yeah.
Anybody else? Any of them feel better than the other ones?
My kidney point hurts. My kidney and my Shenmen are tender,
Okay.
which it makes sense to me.
Yeah.
For sure. Yeah. And then, I don't know. The lung one it makes me feel like relaxed.
All right.
Yeah. Makes me just kind of, makes me take a breath.
So, like a great way to stimulate all these points is thumb in the front and index finger in the back, and you can actually press on both sides. So each of these points have a reverse point to them. Reflection on the back of your ear, right? So you can play around with that, so you're kind of stimulating it from both angles. And it's so, this is like the hardest, it's going to be the hardest thing to do with the Zoom format, is me being able to reach out and guide your fingers to the right place and show you the right point. So we just want to get a starting point. And I think the best way is just to practice on yourself, right? The videos that I share and a lot of the YouTube videos, you know, have some stuff that you can also share with patients. You can start to see what it's like to teach other people. It's just a 5 to 10 minute format I have, and you can just copy that and get in a Zoom conversation with a group of 30 people. There's a lot you can teach people, right? With the limited stuff you got, right? Just teaching people how to incorporate this into meditation or prayer or daily affirmations, or just part of brushing your teeth in the morning, right? And at night, twice a day, right? You don't need to have the seeds and beads. The seeds and beads are great too to have if you have access to it, but that's also limits accessibility in and of itself. The most accessible form of NADA is just teaching people how to press on their ears. All right. Any other questions before we move on? All right. Let's, is everybody hearing me okay? Good deal. Good deal. All right. I want to talk a little bit about complications and complications around the NADA protocol. Things that could go wrong, things to be mindful of, things to be aware of. The NADA protocol, a lot of people, you know, NADA providers actually promote it as a treatment where there's no side effects. That's relatively true. It's relative to a lot of other forms of medicine and medication and even acupuncture treatments, right? This is a very, it's a model of care where there's minimal risk. A minimalist approach. The less invasive we are, the less we're touching people, the less we're getting in their space, whether that's emotionally or psychologically or physically or needly. Those are, the less we get into their space, it keeps us safe. It creates safe space for them too. All right. Less complications is going to come out from a more minimalist approach where you're treating everybody the same. Why does everybody get the same points? Why would that be helpful in a recovery study for everybody just to get the same points? Rather than you know, maybe Ingrid's my buddy because we've known each other for a few years, so I'm going to give her the extra special points. And I don't know Rita that well, so I'm just going to put in the regular amount of points. How is that? How can that impact a treatment setting?
If you have the appearance of showing favoritism, that will make people resentful, jealous.
Good. Yeah.
Likely, very likely.
Yeah. Good.
Oh, what's so special about him? Huh?
Mm.
Yeah.
I've had even where people they say, well, how come she has so many needles? Like she must be really in bad shape, right? Or
Yeah.
What's
or
wrong
how
with
come
that
that, you know, is that, what's that one for? Is that for the liver? Oh, that's because they were an alcoholic, or, you know, like they start making assumptions about each other based on who had more needles or who had needles for what.
Any of your thoughts?
I agree with Bonnie. You know, I work at the halfway house, and sometimes it seems like I have a generator, an auto generator to do UAs. And sometimes one person always his name gets called all the time. So of course they start saying, oh, and then he starts being like, hey, how come, you know, my name keeps coming up? And so I think again, you know, based on, you know, the points, yeah, what is their issue versus what is mine, and the stereotype that it still leads, or the stigma that we still have with treatment and behavioral health.
There's important therapeutic value in behavioral health I've found in this concept of solidarity and having a group of people that are all working towards the same goal. And one of the issues a lot of people struggle with in behavioral health is getting over the fact that they're special, you know, and being able to put a check on our egos. You're special, but you're not that special, you know? You're as special as everybody here. There's no special treatment here. Everybody gets a special treatment. Being able to say that with integrity, the NADA fits really well into that type of milieu too, right? Major complication we want to be aware of, all right? Needle shock, a vasovagal reaction, all right? When basically the blood shunts to the person's core, leaves their extremities, and they faint. All right, this can happen anytime a needle's inserted. Some people are more prone to it. The people that I found that are more prone to it are people that are very women who are thin and frail and anemic, or a really, really buffed up male who's really tough, and they're just like not scared of needles, and they're more common to drop like a fly too. And then anybody who hasn't eaten or hasn't slept in a day or two, okay, they're more prone to needle shock too. Some people are just more prone to fainting. So during your orientation with patients, the first time they come in, when you're showing them, we're going to talk about some group rules, orienting them to those group rules. A good question to ask is, have you had some food today? You get a little food in your stomach. And if not, you know, having a supply of crackers or some sort of snack, some nuts to give to them, some chips to give to them, to get a little something in their stomach, that you're reducing the risk that they're going to have needle shock. And then on that first time, okay, good. Glad you ate today. Make sure you always get a little food in your stomach, because you'll just have a better experience. You don't have to say, you might have a vasovagal reaction and your blood will shunt, and then you're going to faint, and then that would be really bad. And just, you know, you'll have a better experience. You know, I mean, you should be able to explain what the risk of needle shock is. All right. If needle shock happens, they just basically, the person's like this, And they're not just kind of kicking back and relaxing, they are falling to the floor. Gravity is pulling them down. The first thing you want to do is take needles out. Usually most of the time they will go out of needle shock right when you take the needles out. So first get the needles out, get them into a comfortable position. If they're falling down, you may need to lie them on the floor, get them some air, like bring a fan over to them, some water, and they're done for the day. It doesn't mean they can't ever get acupuncture again, but they're done for the day. And if you have an assistant, they need to be with them. It may interrupt your clinic for that moment, but I've been in a large group of people doing NADA and needle shock happens and somebody faints. And because of how I responded to it, it didn't affect. People just kept resting. It was a little odd, but how you responded with confidently, calmly, assuredly responding to this issue, you're like a first responder, right? There's nothing you did wrong. You didn't needle them at the wrong place, all right? It just happens. If the person, if it happens every time the person comes in, they may need to be followed up with a medical provider for something else that may be going on. Okay. Any questions about needle shock or how to deal with it?
Is there a specific point where it's more common?
No, more points. Thicker needles. That's when it happens, right? And some of the more stronger points on the body where thicker needles are really great. It can happen more often. But I think what we know about the NADA protocol, it's not very common with NADA, right? Because we're with a minimalist approach. We're not doing that many needles. The needles aren't going in that far. And we're not stimulating the needles. We're not sitting and stimulating the needles in the person's body. So too much stimulation can cause it to happen too. I mostly only use 3 points, Shenmen, liver, and lung when I'm ever doing NADA. A lot of NADA providers just use the 3-needle approach. I believe, and I found that reduces the risk of needle shock too. Less points, less pokes, less risks, less invasive. I find it to be just as effective as well. And with COVID-19, less points you're putting in, less points of contact, faster you get in and out, we're reducing risk, right? So other people use sympathetic lung and Shenmen. Or you can do Shenmen on both sides, and then on one side do kidney and lung, other side do liver and sympathetic. Excuse me. So that's another way you can maneuver in doing a 3-point approach by getting all the points in. That's something actually I was taught at Lincoln when I got trained in New York, is doing Shenmen on both sides and then switching up the points on the other side, because it was often that patients came in and patients at this clinic were encouraged to say how many points they wanted. If the person is really nervous, right, and they're not sure, then you can ask them, would you just want to sit for a while and see me do the other people in the group, and then we'll come back to you? That's great. Do you want to try 1 point? Just start with Shenmen. And often if you can just get Shenmen in, they'll be open without pain, right? In a painless insertion. Then they'll be more open to trying other points. What you don't want to do is force everybody to get every one of the points. You will not get the therapeutic benefit if I do not get all the 5 points on. All the research shows that 5 points, this is the protocol. You want to get the maximum benefit. Do you want to get clean? That is not that's not in the spirit of NADA. Even if the person sits in silence in a group full of other people with no points in their ears, they're receiving NADA. They're getting the benefit of NADA. All right. The needles are just an instrument to facilitate that silence, that meditation, right? Okay, so needle, other types of complications, really common things. We've talked about bleeding and bruising. Those can happen, you know, as much as 5% of the time when you needle. Bruising is much less common in the ear. Bleeding is, a little few drops of blood is pretty common. Okay, but how are we going to deal with drops of blood? What are we going to do on a regular basis as one of our own precautions? Talked about in the beginning. Kelsey, go ahead and unmute yourself.
Just miming, washing our hands,
Okay.
using hand sanitizer.
But dealing with the blood, how are we going to deal with that blood? How are we going to prevent the blood, a little drop of blood, turning into a problem in our
Giving
setting?
them cotton balls.
Every time. Every time we're going to give them a cotton ball. Go ahead and clean your ear out. It's just part of the routine you're going to do. Come over with a sharps container and a few cotton balls. Here's some cotton balls. I'm going to take some needles out, then you can just wipe your ear down. Okay? And if you just give them cotton balls and you don't tell them what to do with it, then people will just be often will just be looking at the cotton balls. What do I do with these? Where do I rub? So sometimes you got to be very explicit, you know. Here's some cotton balls. I want you to wipe your ear down really good. Be very explicit. Don't just hand them out and assume they're going to know what to do. So once they get into the routine, they'll just know this is just part of my treatment, all right? So bruising, if there's a bruise, if you notice a bruise is forming right after you take a needle out, one of the things we talked about, what can we do to deal with that?
Massage it out.
With a cotton ball.
Great.
30, 60 seconds. All right. That will help to manage that bruising from getting worse. Sometimes it can be left with a bruise in their ear. It's often just very light purple. It can turn yellow, greenish too with other types of fluids, but usually in the ear, it's just going to be purple that you see. If they come back the next time and they got a bruise on a point, you're not going to needle that point. You're going to let it rest until that heals. Okay? Another complication, we talked about falling needles, right? So we've already covered that. Any questions about falling needles? One of the things that can happen is that the needles will fall onto the floor. Right, when you're needling, needles fall on the floor for whatever reason, right? If the patient is just distracted by that needle on the floor and they're like pointing it out or they're picking it up, then you want to go deal with it, just get it disposed of right away. But if you can wait till the end and just stay calm, that's even better. If you're stopping for every needle that falls on the floor, first of all, you need to review your technique and your confidence in getting that needle to stick. You need to go in a little bit further. But second of all, you don't want to be stopping. You know, you put a needle in, it falls on the floor, put everything down, go in and pick the needle up, take back the sharps container. That's going to just increase the risk of contamination of your hands, and it's just going to look really messy. Sorry, excuse me. Give me 1 second. I'm going to pull something up in. I'm going to pull up the NATA guidebook. We're going to the NATA resource manual. We're going to look a little bit more at needling complications. You everybody see that?
Mhm.
Okay, cool. So we already talked about needle shock, hematoma, swelling, or bruising. Now we got 3 left here. Needle through the ear. We talked about that this could happen. Often it usually happens on the liver point when you're tubing the ear. If you tap it in too much, it's more of a risk of the needle going through the ear. So you don't need to tap that much, okay? But it's often that liver point. So this is why you don't want to hold that ear because you might stick yourself, okay? But if the needle goes through the ear, often the person is not going to notice it. You don't really need to make a big deal out of it. And what you don't want to do is be like, oh my gosh, the needle went through your ear. Yeah, and so you just want to maintain calm. Now, if they notice it and they're really distracted by it, then you might want to take it out. Okay. Infection, very rare. We've never had any report or complaint or any claim in the 90,000 treatments we've done down here around infection. It could happen if you reuse a needle. It can happen if you don't follow clean needle technique. Okay. If a person shows up and their ear is infected, it looks inflamed or infected, just don't needle that ear that day. Okay. If a person comes and they said, you gave me infection with your needles, what you don't want to do is say like, that can't happen. What you want to do is refer them to a medical provider. Okay. And then you want to report that to your malpractice insurance carrier. Because if you don't report that, if the patient tells you that something happened and you don't report it and you don't chart it, then your malpractice is not going to cover it and you can end up in a very sticky situation. But if you do report it, then they're going to have your back representing you if that claim ever goes to court, okay? Do you have a question, Sierra? Okay.
I'm just stretching.
Okay. More of a risk of infection right now we have to be aware of is COVID-19. And it could be that, and one of the dangers in having opening up a clinic right now is that a patient accuses you of giving them COVID-19 by coming to your clinic. So it's a huge liability. You know, in fact, NADA recommends not doing acupuncture right now. That's the safest thing to do, is to not needle right now. And to just stick to seeds and beads in your acupressure and a little less invasive techniques. So there's going to be some paperwork we'll go through in a little bit, some new paperwork about some new different types of consent forms. People who are coming into your clinic should be aware that they're taking a risk by coming and getting treatment right now during a pandemic, right? You want them to sign a waiver stating that they understand that there's a risk that they may get COVID-19 getting treated by you. Okay. There are acupuncturists in the United States that are claiming this is a hoax, you know, that are claiming that what people are really missing is acupuncture. And I don't think that is a helpful thing at this time. I think a humble approach is much better and much more needed right now. So, so be humble, know your place. I do not think acupuncture is an essential healthcare activity, right? And that's really not my battle in proving that acupuncture is an essential, right? I think, you know, so that's my opinion. So another complication that can happen is headache. Often it happens by the sympathetic point being in too deep, but it can happen on any point, and some people are just more prone to headaches. Some people with chronic migraines, ear acupuncture helps their migraines right away. Putting the NADA points in, boom, headache gone. Other people, it causes a headache. It's too much, and some people, ear acupuncture is just not going to be appropriate. So if they say, oh, I got a headache last time, try it again. Try adjusting your technique. Try using fewer points. But if every time they come back, they're like, I just get it. Every time you put those ear points in, I get a headache. You know, you might need to refer them to an acupuncturist. There may be other points that are better for them. It doesn't mean they can't get acupuncture, but sometimes the ears is just a very sensitive organ. So be mindful of that, okay? So yeah, that's kind of what I have to share on complications. Any questions on stuff that can go wrong?
Just a question, I guess, in a roundabout way. When I was looking at these points, I was thinking about individuals who actually have their ears pierced in those specific areas.
Yeah.
Do you encounter that or?
Yeah. Yeah. Patients that swear by it. And, that is not something I have any training in. I don't know the science behind that. I don't know. There's also battlefield acupuncture where they'll actually leave a tack in your ear and send you home with it. Right. And then you'll keep it on until the tack falls off. That's the military's battlefield acupuncture. Shen Men's one of the points they use, and they use 5 other points in addition. So there's different types of auricular medicine, right? There's seeds, there's bleeding, there's magnets, there's acupressure, there's little, electromagnetic probes that the provider will place in your ear and make this sound and find the right point. And so there's lots of different people out there. It's very fascinating, auricular medicine. When I came to WADA's the first time, I saw people on the streets with up to 20 seeds on their ears on pieces of tape. And I asked them, where'd you get that? Oh, we got it at our local church. So it's really well familiar within lots of different folk medicines, auricular therapy. And I am not familiar with the science or how that works. But I think what's important, asking the patient, did it help? Is it helping? Yes, it's helping. Great. Go with it. That's my main question when people come to me like they're trying something new that I'm not familiar with. Oh, wow. Maybe I need to learn more about that, So, yeah. Auricular medicine is one of the oldest forms of medicine. The Egyptians cauterized the ear, and Hippocrates used different ear techniques. So for some reason, it's something that's lasted a long, long time. So yeah, which is what's really cool about NATA, bringing it back to incorporating it in just everyday healthcare. Rather than some specialized or over professionalized or something that costs a whole bunch of money. NATA is like the modern day way of bridging that divide. So in a pragmatic and non-invasive way, in a down-to-earth way, responding to public health needs. All right. So I still want to cover, some group management, some best practices. I want to talk a little bit later about contraindications. We'll cover some of the forms that are recommended right now during COVID-19. Want to cover seeds and magnets as well. So there's a lot we still got to cover in the next hour as we finish up. But I just want to do a quick check-in. I want to hear from everybody, how taking all this information in from all these courses over the past few months and now moving to a more, just some pragmatic stuff about how to work with people. How are people feeling about where they're at in taking all this training? What are some emotions? What are some thoughts y'all have? What are some hesitations? What's your excitement? Can everybody share? Just go ahead and just chime in.
Well, I'll chime in. I'm really excited. Like I said, I have a transitional living house, men coming out of prison, and I also do intensive outpatient treatment. So I've been fortunate enough to have everybody there at the house to be able to do therapy and treatment. And we're minimizing the time that they're actually out. So basically, if they go to work, they go to work and they come right back. We just had an influx or actually everybody's been quarantined because somebody was exposed to somebody else. So I'm really excited because I think I know that it helps a lot of or will help a lot of my clients that don't have the, you know, they've been institutionalized forever, and to be able to not have to go somewhere where I do make them go to the clinic, you know, prior to COVID, but now that it's there, and, you know, all of these other techniques are really going to help throughout that process. Again, a lot of the guys that I get coming out of prison, yes, they're addicted to Suboxone. They're still addicted to, you know, heroin, whatever they've done in prison. They just managed to skate by UA getting out. So they get to the halfway house and they're struggling. So I'm really excited, and I know the guys are really excited, and some of them have had, you know, treatment. And I know, Ryan, you were saying, because I live in New Mexico, so it's the prison system in New Mexico. So people are going in and doing some treatments. And I know now it's okay. Yeah, it was all good for a while, but to keep the, you know, momentum, and, you know, I'm really excited because I know that a lot of the guys that were in prison, when I was telling them about it, they were saying, wow, that's going to be awesome. And again, I think that what learning, you know, these last few days, and, you know, the other modules is, you know, people think, and just like any kind of treatment, you go in one time and we'll see you in 2 weeks. So me having the ability to be there and to work with them, not just, you know, once a week, you know, I'm able to work with them, shoot twice a day if I have to, you know, 3 times, you know, during the week, instead of just, okay, come now and then we'll see you next week. I think that, you know, the continuum of care is really what's lacking in our country, period. And I think I'm really excited to get going.
Thanks. Yeah. Need a lot of help in New Mexico.
I'm excited about the ramifications this has for eliminating racism. I have many prejudices, and well, I don't say that as a racist. Now I'm really putting my foot in my mouth. No, we have a situation of white privilege so much, and I am such a recipient of the white privilege. And the video that was on one of the sites about the drug war, I believe it was. And I've seen the author of the book of the New Jim Crow telling about how the Black people are simply so, it's a different world. It's a different culture. This is where a lot of the drugs exist. And I think, you know, not promoting this technique in the population to try to get the drugs out of it, like Retta is doing.
It's Retta. Yes, ma'am.
It's Retta. Okay, it's
Yeah.
Retta. Okay. I'm not making much sense right now, but I just see very, very huge implications in this fight against racism in this country.
Yeah, well, this is a really unique tool, the NATA. That can be taught to communities that I'm not a part of, cultures I'm not a part of, and with the goal of them taking control of their own healthcare and going beyond just lip service or charity or helping the people who are other than me, but putting the tools in their hands and supporting them in their direction. And so yeah, and yeah, most acupuncturists are white, you know, and so yeah.
And it started, all of the whole movement started with the not with the Black Panthers, but with somebody else.
Yeah, some members of Black Panthers and the Young Lords. So yeah, 2 different groups representing, you know, activists representing communities of color. So yeah, it's
self-esteem and to, you know, change some cultural transformation there.
Yeah,
I think it's wonderful. And when I saw the video that you put on there about the cause of the war on drugs, why it doesn't work, yeah, it was, that got me very excited.
Yeah. Thanks, Ingrid. Anybody else?
Yeah.
How they're feeling, where
Um,
they're at? Bonnie, go ahead.
yeah, I'm getting really excited. It's and trying to figure out ways to integrate this into the work that I'm doing. Probably not so much in my own clinic, but hoping to get back to volunteering again soon. And I'm actually in the process of setting up some volunteer work with our local Black Lives Matter group. And one of the things I think that, even if they're, whatever their background is, maybe they're not addicted, but they're right now, I think the Black community is under fire big time, just because they're standing up for their rights and people are not happy about it. So they're being attacked, they're being criticized, they're trying to organize rallies. It's a ton of extra work on top of what, maybe their regular life, their regular job. So, they're having a lot of stress. So hoping to start working with them soon. And because in Ontario, nobody can needle unless they're a registered acupuncturist. But I'm starting to think, oh, maybe I can teach them how to use the seeds, how to use the magnets, and they can do that, So it's and just the seeing the approach, that's helped a lot, because I did a little bit of auricular training once before, but it was, like a 3-hour afternoon workshop. Here's the ear, here's the point, stick the needles in. That's what, but seeing or learning more about the approach and, how to do the group setting, just having tips about that and better location. That's all really helpful. So thank you.
Yeah, great. Yeah, Kelsey, Sierra.
I'm doing pretty good. I'm here in Arizona and I'm looking out the window and it's raining right now. So that's very exciting for us. Whenever it rains here, it's like, yeah. So that's just fun. We get the monsoons. But I'm doing good. I'm just excited. So I work in the medical clinic and we have an acupuncturist there at one of our sites and she agreed to supervise me. So that's great. But it's definitely be a process to bring everybody on board about how that works in our medical clinic and all those things. So I know it'll be, kind of a challenge. I'm looking forward to learning more about that aspect too. Yeah, doing good.
Great.
Yeah, I'm feeling good about the courses that we've done together, with you guys. And I know that someday I'll be able to treat people again. And that will happen. And I'm excited about everything that everyone else has already said, and also connecting with other people who are serving their communities in various capacities around the continent. And I'm looking forward to the services that I can offer expanding. Because community acupuncture started to feel like it wasn't enough. I think I said at the beginning of this series, like, I don't feel like I'm doing enough. So I feel like NADA will help me with that. And I'm also looking forward to maybe getting some of my colleagues to move outside of just community acupuncture also. Because I told one of my fellow community acupuncturists that I was doing the NADA training, and she was like, why? And she's a community acupuncturist, and she's, committed to affordable acupuncture, but she just, like many acupuncturists, think of NADA as the five NADA points and not as like a larger container. So I'm hoping to get some people on the bus, get some of my colleagues on the bus. And doing seeds and beads and magnets is, I think, it's going to be one of our tactics in California to eventually having an ads law, is getting the same people who we hope someday to be ads, acu detox specialists, to have seed services in their programs. So, anyway, yeah, but there's a lot in my head.
Cool. We
You know, with me, I've just enjoyed the classes and you know, reading over the book and everything like that as well, and watching some of the videos, of course, and everything, and of course, I've got all kinds of ideas going on in my mind of how it can be used, where it can be used, and how I think can be implemented. You know, and then one part of me saying, "Slow down, man, slow down. You know, don't get too far ahead of yourself too fast here. You know, it's gonna take you some time to practice and get the techniques down and to be able to make sure that you're doing everything properly." And I noticed that just from, you know, reading even in the booklet itself. I mean, it's not very long, but there's, you know, some definite good information in there that I'm gonna want to go over several times to make sure I know it secondhand without having to, you know, kind of look back and everything. So I'm excited for what it can do, and I'm glad that you put on this little series. Appreciate that.
Yeah, well, this has been a really fun group. It's great. We've got all of you have kind of stuck together. I know Retta just kind of came in more recently, but she's been kind of tagging along on watching the videos too. So, so yeah, it's been a good group, and it's been fun to explore in this past 3 months just the possibilities and meeting other people who are passionate also about this time in history right now and what we can do. What are the possibilities? How do we get out there and be a part of the solution? And the hard thing is that we can't really get out there. We're having to pull back our dreams and our ideas, and it's great we get opportunities like this to explore and to go deeper and grow and do that internal work, which a lot of what NATA is doing that internal work, you know.
I have a quick question.
Yeah.
Just wondering, so what is the status of acupuncture in New Mexico right now?
Yeah, well, we can practice. The New Mexico Acupuncture Board has not ever told us we can't. They said it's kind of up to us to determine whether or not we're essential or not. And we've just got, like every place, you know, regulations about, you know, recommendations and things we have to do in order to safely practice. So yeah, and so yeah, so yeah. You know, right? I think I want to talk next.
Can I make a suggestion?
Yeah.
Why don't we could get an email list or something and communicate and see what each other is doing in the future. And
yeah.
I mean, I have contacts in Colorado and Arizona and New Mexico and even in Canada and Albuquerque especially. And you know, maybe we could support each other in some project or.
What I recommend doing is go ahead and put your contact information in the chat. And then we have a Facebook group that I want to connect you all with.
Great.
The end,
that
which is kind
wonderful.
of how we kind of keep all of our students that we've all that we've trained. And we've got a separate one for our group in WADAs I'll connect you with on Facebook. So we'll come back around at the end, but we got a few more materials to cover, okay? And this all has to do with really important thing, especially right now in this COVID-19 environment, boundaries. So we're going to talk about, come at this last part from the framework of boundaries, okay? We talked Wednesday about Brene Brown, and we talked about some of her her work and some of her writings, and one of her concepts that really I think connects with the spirit of NATA is this. Clear is kind. So in the context of the discussion of boundaries, clear is kind. Not clear is not kind. So if we're clear about our boundaries, that is kind to people. That is kind to the world, right? If we're not clear, then that's not kind. That sets the stage for expectation problems. That sets the stage for this fuzzy ground where I'm embarking on a new territory and there's not clear boundaries. So NADA has always been about creating a safe container for everybody. So now how we're going to try to bring NADA into this world, whenever that is, whatever that's like, it's got to be with that as the assumption. Being really clear, right? If you're like, oh, you can wear a mask if, you know, if you can't socially distance, you know, I think it's good to wear a mask. But try to keep your distance. Those things aren't clear messages, right? So the other day, you know, a volunteer came to my clinic, you know, and we saw each other in the parking lot. He wanted to give me a hug, and I had to take a step back. Clear as kind, you know, as hard as it is. You know, I'm thinking about his best interests, his family's best interests. I'm thinking about mine, my entire clinic. You know, I'm no use to the community if I'm sick. You know. So so let's talk about group in general, and then let's talk about what group looks like in a COVID-19 environment. We talked a little bit about some dynamics in group earlier, but group acupuncture, first and foremost, you're not treating one person, you're treating everybody. So you've got to create an environment, and you've got to have patients that can fit into that. And you've got to create a culture and rules and boundaries to set that up for success. All right. And if you're not comfortable with that, then you might want to start out with 1 or 2 people at a time until you get comfortable with that, and then move on to 4 people at a time. All right. So yeah, you know, doing group acupuncture, doing data treatment's a great way. You know, if you got social anxiety, this is a great way to deal with this deal with this head on. You know, I've got social anxiety. Doing group acupuncture helps me to work through that. You know, and getting out of my comfort zone and being around other people. So you've got to be able to be mindful of the larger container. Maybe you're comfortable in your comfort zone's the one-on-one. So just be mindful of that, right? Because that might be a challenge for you as you go into the group, you know? And maybe your comfort zone is treating a whole bunch of people at once, right? So right now, this COVID-19 environment, it's might be hard to contain yourself, right? Putting a check on the expansion of something and creating something really small that's clear for everybody, right? So when we're in a group setting, doing NADA, we're needling, and we got our eyes and our ears peeled all the time. We're tuning into the entire room. Go needle one ear, take a look around. How's everybody doing? Is there somebody, their face is like, may want to go, you got to put a pause. Hey, I need to go check in with the patient. I'm going to be right back, okay? Hey, what's going on? Yeah. You want me to take the needles out? Are you comfortable? We want people to, and I've had patients like that. I come check in with them and they're like, yeah, I'm having an intense experience. I need space. Okay. All right. A good thing to do is encourage people, teach people from the start to raise their hand when they're done or they need something. Give them permission to speak up. Right? Otherwise, they're like, how long should I sit here for? What? You know, like how, and they can get impatient. And that can prevent them from coming back if you're not clear. So setting those expectations from the start, part of that, I'd recommend cell phones off. You know, I actually tell people, can you just take your cell phone out? I just need to see that turned off. That's what we do. That's ticket in the door. Because it's the most disturbing thing for the whole container. When that cell phone goes off, it ruins everybody's treatment. And now we got complaints. And now that person didn't get their needle nap. And now they're complaining they didn't get the complete 100% relaxation. So being really clear, these are my rules, you know? And cell phones off. Some people have never turned their cell phone off. Your cell phone needs a rest every day, just like you. You know, you're teaching people how to give NADA for their cell phones. So helpful, good for the cell phone world, which is good for the entire communications universe, which is good on stress, which is good on them. And they get a break from their phone. Turning cell phones off is part of the spirit of NADA. It just is. Giving that a break. Okay? Teaching people, hey, I can live without my phone for a while. That's so important right now. So, other rules. Encourage people to sit in silence. You know, if somebody's speaking up, you know, just gently asking them to be quiet. If they're not able to respond to those types of directives, right, they may need to be asked to leave. They may not. There may be some patients who are disruptive enough to the point where they're breaking the container, right? And maybe you like that person and maybe you don't want to piss that person off, but you're not just working on that one person, you're working on the whole group. This is a group experience. So, yeah, people who are drunk, you know, people who are going through acute withdrawal, like severe acute withdrawal, people that are going through a mental health crisis, people who are in danger to themselves, who are in danger of others, or somebody's chasing them. The NADA clinic is not going to be the best space for them. We can help more on the subacute withdrawal end, unless we're working on a psych ward, right? When in an inpatient acute setting where the medical director and the doctor are all part in providing acupuncture in that moment, that would be that's a very rare case. There's not many clinics like that. AccuDetox more for the subacute withdrawal phase and the recovery phase, keeping people clean. All right. Now, after the person gets through their suicidal crisis, right, they get to a place after they get through that medically managed alcohol withdrawal, that's when acupuncture can help with post-acute withdrawal, right? But you're not doing the group or that person any favor if they're going to be disruptive, right, to your clinic, or whether it's not safe for them, right? You don't want that person to keel over from going through alcohol withdrawal during your group. That's not going to help your group. That's going to ruin everybody's experience. Same thing with other types of medical conditions, respiratory problems. Right now, you know, I recommend screening people out, people who have new respiratory problems, right? And any of the COVID-19 symptoms, I recommend not treating them. Taking a temperature before they come in your clinic. You know, if it's 100 degrees or above, not appropriate to get treatment that day. And so this is all setting in these boundaries on the front end. They don't have a mask, they're going to have to either bring a mask or you're going to have a mask for them. If you don't have enough masks, can't treat them that day. They come in the door, they put hand sanitizer on, and they're encouraged to put hand sanitizer every time they go somewhere. It may be best for your clinic to not open up the bathrooms to people. Bathrooms are one of the most infectious places to spread disease right now. So that's something you have to think about. And if they are going to use your bathroom, how are you going to protect yourself? How are you going to clean that bathroom, right? That's a whole nother ball game you're responsible for. So, yeah, another thing about the group rhythm you want to be mindful of is get in the habit of, before you go into treating somebody, glancing around the room and seeing if there's anybody that needs your immediate attention or needs to get up. You're gonna look around. Second, are there chairs that somebody just vacated that haven't been cleaned? You're gonna go to that chair. You're gonna make sure there's no needles on that chair. There's no needles around that chair. And then you're gonna have to disinfect that entire chair. All right? So So look around. Does anybody need to be de-needled? Does anybody need your immediate attention? Is anybody nodding off that could go into maybe going into needle shock, right? Second, looking at the chairs, getting the chairs all ready. Third, checking in with your team at the front desk, see if they need you or anything, being mindful of that end, right? Then at the very end, now you can go needle the next person. So get into the habit of that as your rhythm. That will prevent any problems from happening. So we're slowing things down in COVID-19. Everything's slowing down, and NADA is the same thing. We're just going to go slower. So yeah, any questions about group management? Setting boundaries in your clinic? Situations that might come up that you're worried about? Okay. So some contraindications. You know, if people's blood pressure is out of control and they're not getting that managed by their medical doctor, they may not be appropriate for care. Acupuncture might be able to help with their blood pressure, actually. All right, there are blood pressure clinics that use NADA as part of the regimen up in Colorado, particularly, that have done research, have used NADA for that purpose. But if they're not being medically managed, you don't want them to have a heart attack or a stroke while they're in your clinic, you know? Be mindful of this. You know, if a person has a heart attack, right, or contracts COVID-19 while they're at your clinic, right, then even if it's not, or they say they were contracted, even if it's not your fault, a lot of the medical system is not going to look favorably upon alternative health providers. They look at us with more scrutiny, right? Hospitals are going to get much less scrutiny than somebody's working on the fringes in outpatient care with people. So raise the standards, right, of cleanliness in your community. You know, NADA clinics should just always be above and beyond what other acupuncturists are doing. Acupuncturists, we get really lazy. We like to do our own thing, and we're all mavericks. And, you know, I get patients telling me, is it okay that my acupuncturist licked my needles before they put them in? I've had patients tell me that, you know. Is it okay that he needled through my pants? And there's acupuncturists that do that. You know, there's acupuncturists that'll stick a piece of ginger and take a 6-inch needle into the gluteals through that piece of ginger, and because they learned it in a workshop. So there's all sorts of stuff out there. So NADA is bringing some grounded, just safe, you know, paradigm of acupuncture to the healthcare system, right? And so yeah. And maybe an acupuncturist teaches you some new thing that is outside of the spirit NADA, outside of this model. When you're doing the NADA treatment, stick to the NADA model. All right. That's my recommendation. So, okay. We're ready to move on from contraindications and boundaries. We clear enough? Okay. So I'm going to pull up a few forms. This is a form that's being recommended for all clinics to have signed by their patients in addition to a regular consent form that you have. Everybody see this? Okay, so this is all in your Dropbox folder, okay? this is a good thing to have sign when they come into your clinic for the first time alongside other types of intake folders. This is not a consent for acupuncture. This is a consent for someone to get medical care during the COVID-19 pandemic. Okay. I'm going to pull up one other forum that I sent an article to last night. This is this is an article by Claudia Voiles, who's been one of our guest teachers, one of our RTs over in Austin. She also works for the she's an acupuncturist for the Department of Veterans Affairs, and she just wrote this, published by NADA this week, about some guidelines for doing NADA at this time. NADA protocol for the pandemic, returning to in-person treatment. We've already talked about a lot of this stuff, okay? I'm not going to go through this. Something that I recommend reading, right? Here's a link to state-by-state description of face mask requirements, okay? A guideline on how to reuse masks, all right? The types of masks that are ideal, right? And so yeah, any question about how to do particular things about how to do NADA during the pandemic, in case you decide to get your clinic going or you're working in a place where you're doing NADA during the pandemic?
Well, I'm still seeing the one that you had up there, so I didn't see that one, even though I know which one you're talking about.
You're not able to see the article on AcuDetox.com?
No, I still see the COVID-19 consent form.
Sorry about that. Let me try that again. Sorry, I shared the wrong screen. Can you see it now? Returning to in-person treatment? Okay, cool.
Yeah.
This is one of the articles that I sent along with the Zoom link to this discussion last night. Very important that you read through this, okay? All right. So here's the link where you can see state-by-state descriptions of face mask requirements. And then here's some discussion about how to reuse masks in a safe way. Okay. And this is on AcuDetox.com on the news section, or the link that I sent to you, okay? Any other questions about doing COVID, doing treatment in a COVID-19 pandemic world?
I don't have a question, but just to share an experience. Our insurance provider advised us against having having patients sign a COVID statement, but giving them the information, because they said we could be accused of or they would be signing it under duress or something, with if there's a thought that, oh, I can't get treatment unless I agree to this. I don't fully understand it, but maybe just check with your particular insurance provider where they stand on that.
Great comment. And be mindful that insurance companies are still trying to figure this out. And I get conflicting answers from the same malpractice insurance company on an ongoing basis from different colleagues of mine. So the best thing to do if you're in doubt is to call your malpractice provider and ask them, and ask them for really clear guidelines, right? And then right now, stick with whatever they say. If they, and so maybe 2 months from now, they're going to say you can't do acupuncture. Then you're going to have to follow that, okay? And maybe they'll change things. So there's constant ebb and flow, and the responsibility is on you to stay up to date, okay? It's not my job as your trainer. It's not NADA's job, right? It's not the NCCOM's job. And it's not even your malpractice provider's job. No, the only responsibility you have is you. So just remember that, you know, you're the one taking the risk. It's your responsibility to set up the best environment possible and to stay up on what you need. So it's a lot of work. It's not, I've been doing acupuncture for a little over a month now, and it's just not as fun as it used to be. You know, it's very stressful. It's constant thinking through stuff, you know, but that's on me. You know, I'm the one that wants to stay open and offer this service, you know. So it's my responsibility to stay on top of all this stuff. So, but thanks for bringing that up, Sarah. Yeah. So yeah, and you can call NADA too, and Claudia, you all have, she's been one of the teachers. You all have access to Claudia. If you forget her contact information, let me know. I can get you in touch with her. She's right now, she's working with the Department of Veterans Affairs. So she is a really great resource on research, on best practices, on safe practice. And so we've got a good team to support you. So what you don't want to do is just being like, oh, I'm too stressed out about this, so I'm just not going to ask questions. I'm just going to keep doing what I was doing. That's when you're risking. That's when your risk gets even more put up there, because you're just kind of walking out on a plank, you know. So, but there's a community to support you. Okay. Yeah, and now in this group, you know, Sierra and Bonnie and I, our profession is acupuncture, so we've got resources too, right? So feel free to ask us, you know. And if I don't know, you know, maybe one of you all has a good answer. So yeah, together we can do this. So, any other questions about this? Cool. I want to pull up another thing that I sent yesterday regarding communication. And where is that at? Hold on one second. Give me just 1 second. There's one more document I wanted to show you all. I'm having trouble finding my screen here. Okay. Can everybody see this document? 6 steps to follow when treating people for the first time. Okay.
I'm seeing your
try one more.
Gmail.
Okay. There we are. Can you see it now? Cool. So this is another document I sent last night. This is more of a general guide for community acupuncture, not specific to NADA, but most of it applies to NADA. And this is like as thorough of a job that you could do, and how to set expectations on what people are going to experience during the treatment. So I find that going through these steps, it's very exhaustive, but it really minimizes patients' complaints, and it really sets it straight. It's really clear, right? So it's just about setting the rules straight from the start. And this is something you only have to do in your first time during that orientation. And it's just a real pragmatic discussion, straightforward. So I'm going to put some points in your ears. You might feel some tingling, warmth, pressure, or a little achiness, maybe some heavy sensations. These are pretty normal. That means the needles are working. But if anything's pinchy or sharp or it's uncomfortable, if you need to leave, raise your hand, and I'll come check on you. If you have your eyes closed, I'm going to assume you're all as well. You got any questions? So after they get the paperwork signed, this is a great way, a next step. No questions, get the needles in. They have questions, do your best to respond. If you don't have an answer, tell them, it's a good question, I'm going to look into that. Next time you come to the clinic, I'll have an answer for you. Or I'll give you a call to follow up, okay? After you put the needles in, anything pinch? Is anything sting? That's the question I'm going to ask them. I'm not going to ask them, are you okay? Do you like that? Just a real simple, clear question. Does anything sting? Does anything pinch? Often the person can tell you which of the points pinched, and it often just needs to be backed off or taken out altogether. You can try rotating it, backing it off a little bit, then ask, how's that feel? If they're like, oh, it's even worse, then just take it out, okay? If it's really stinging, you can take a cotton ball and just have the person give a lot of very vigorous pressure to the ear, and that will help. If you have a little analgesic ointment, having them apply that can help as well, okay? So communication about the sensory experiences of needles. I really feel it's really important, and it's our responsibility as NATA providers to speak really directly, right? And what I don't find helpful is to tell people this is not going to hurt. I don't find that's a helpful thing to say. What I can say is that, it's normal to feel nervous about needles. I had fear of needles before I first came in. So normalizing the fear that people have that it's going to hurt rather than denying it. This shouldn't hurt. My needles don't hurt. That's just not great culture to develop in your clinic. Normalize it. Assure them. I have, I really strive for a gentle technique. You might feel some things. We want you to feel something. Numbness, tingling, pressure. And a great thing you can tell people is like, I tell you, the most common side effect of this is you just fall asleep and take a nap and you wake up feeling refreshed. You can stand on your own 2 feet in saying that. And it's normal to be nervous. So these are some talking points that I encourage you to really incorporate into your repertoire. These, I believe, are as important as knowing a whole bunch of more points to put in or having the perfect point location. Acupuncture NATA is a very nonverbal treatment, but how you talk about it, how you engage with people, how you respond to their questions, how do you create that safe space, right? How do you be really clear with your communication and really direct? How do you, respond to their concerns? Those are all a part in creating that nonverbal space. All right, I'd like to think that people can just sit down in a circle. Everybody's just going to be drawn to these open circles, and people just sit down and no words, and the needles float into their ears, and everybody's in bliss. And I wish there was a world that just happened magically. In some places, I've been in NATA clinics where that does to some extent. But your ability to sustain and have a really high quality service, right? And honor the experiences that everybody has and their fears and their emotional stuff that they bring in, it's going to be really key to having a successful NATA clinic. So there's a lot of good stuff in there. Here we've got a list of normal sensations. So these are all normal stuff to feel. Don't be surprised if people report this. You can just be, oh, well, I had some weird sensations. Tell me, what did you feel? It was like this achiness. Oh, yeah. It was like this itching. Oh, it was like this tickling. Oh, okay, yeah. But That's a normal sensation to have with acupuncture. That means the needles are working. It literally means that this is the body's energy just moving around. This is just an expression of when the body's energy starts to circulate. Okay? Warm sensations, cold sensations. People's body tend to cool down when they're getting acupuncture. So don't be surprised if people feel a little chilled afterwards. Having some blankets can help. If you do bring blankets into your clinic, you're going to have to wash them after every single patient. You can't reuse them right now. Uncomfortable sensations that persist that we don't want. Pinching, sharpness, burning, nausea, faint, or dizziness. So I want you to remember those, okay? I also tell people, if something's just feeling too intense for you, I can always take the needles out. It can help if you're having these odd sensations that you're not sure about, like you're feeling really relaxed and that's bringing your defenses down too much. What you can do is just take some deep breaths. So people's breath is an aid in making NADA work. If somebody's really, really nervous or they're really sensitive to needles, while you're needling, what you're going to do is you're going to ask them to breathe in. When they breathe in, you breathe in. And then you say breathe out. At the moment they breathe out, then you're going to insert the needle. That will minimize pain. And when you're starting out, I would recommend doing that on everybody. Just breathe in, every needle, breathe out. Okay? So those are really going to go a long ways in helping get in sync with people with where they're at. And if you're feeling nervous, sometimes I've been needling and all of a sudden I just get randomly nervous, right? I'm like, what do I do with this? I got a needle. People are looking at me for relaxation. I'm getting nervous. So it happens every once in a while. So I'm just going to breathe and I'm going to have the person breathe with me. Right? Just getting us in sync, getting them used to breathing deeply. So that's a really good best practice for NADA as well. We already talked about needle shock quite a bit earlier. I hope this is helpful. This stuff, I find it really helpful. A lot of my students find really helps them too. And a lot of patients have never had an acupuncturist actually explain to them what is normal. There's a culture of acupuncture, and there are some subcultures of AcuDetox, where they literally say, no pain, no gain. If it hurts, it needed it. There's a philosophy, and there are schools of acupuncture out there that believe that. And if people tell you that, it burns, stinging, but my acupuncturist told me that that's what I really needed. What you can tell them is that, well, in my clinic, we don't like those types of sensations, What I'm going to do is I'm going to back that needle off. So we're educating people out to having a different type of relationship with needles too. All right. AcuDetox is like community acupuncture, is open source acupuncture. We're taking acupuncture out of the ancient modern Chinese secret, and we're opening it up. This is just everyday healthcare, right? And that's what I think if you come into that with this spirit, it's going to connect with the larger group of the population out there. You're going to help a vast majority of people. There are people that like acupuncture more as like acupuncture more as a magical activity. They really are drawn to that. There are some NADA providers that put NADA in, and then they give a lecture on astrology. And there are patients that will respond to that. But I've seen in practice that the majority of average people in that group are not looking for an astrological lecture. There's a space for astrology and all of the stuff in our heads and our hearts that we want to share with people. But having those boundaries between the silent group space, right, and the other stuff we have to offer it allows, I think it allows people to be able to integrate this on a deeper level. So But there are different opinions around on this, you know, and you might have your own opinion. And so yeah, any questions about how to talk to people about NADA, sensations? Well, really being able to speak and represent NADA comes down to your knowledge of it. So a lot of the readings, think of those as like layer that stuff in, right? If you really want to represent NADA, get familiar with different perspectives on NADA and all the readings. I know it's a lot of readings I sent you because I want you to have as many resources as that can help for you, you know, so you can deepen your knowledge. So yeah. Yeah. So I want to talk a little bit about seeds. Real quick, if you have your seeds with you, I'm going to turn on a light here. It's getting a little dark. I'm going to turn on a light real quick. All right. So let's grab the seeds, which is this tab. We've got seeds, and then we've got these gold magnets. Well, they're not solid gold, but that's how they're marketed, gold magnets. So, but they are magnets. So we've got two little tools in our NADA belt that are not needles. All right. Well, we've got another one, just our hands pressing on the points. All right. So let's talk about the seeds. Seeds are used in Chinese medicine for tonification. So they're really good with NADA, tonifying in between treatments, tonifying that yin, right? And you can either use some tweezers to peel back, or you can use your finger, depending on how well you do peeling the little band-aids off of the tablet, right? And then you can do it with your finger. You can hold them, pinch part of the band-aid with your finger, and then put it on, right? Or you can grab it with the tweezers or a hemostat. And you're going to place it on the person's ear. You're going to place it on the person's ear, but I don't recommend in the NADA setting rubbing it. It's just too intimate, right? Teach the person, so just place it gently and then have the person reinforce the sticker by, can you go ahead and feel for where that seed is and give it some pressure? Do you find that? Are you able to find the seed? Oh yeah, there it is. Oh, okay, yeah. So what I want you to do is press on that for twice a day, 2 minutes at a time, or whenever you get cravings. Okay, so incorporate it into your daily practice. Maybe you're doing some other stuff with them around meditation or mindfulness or affirmations or you know, big book sayings or any number of things, you know, some sort of spiritual like mantra. That's a great use of that, having the person close their eyes for a few minutes at a time, twice a day, to give it some pressure. And these really, these putting them in on the points, I usually do Shen Men, liver, and lung. That's usually the only points I use for seeds. So just those points with the pressure is really good for cravings, withdrawal symptoms, and just kind of general relaxation. You don't want the person to press too hard, or else that can just cause pain. Some people are very sensitive to these seeds, and so if they feel like it's triggering a headache or nausea, just have them take it off. For some people, it's going to be more effective than others, just like NADA. Okay. The acupuncture needles have a very sedating, immediate impact. It's more of a dispersing technique, right? That's where the seeds are more of a tonifying technique, more of a subtle kind of helping sustain recovery between treatments. And so if they come back to your group and they got the seeds on, have them take it off. You might need to wipe it down with some alcohol to clean that ear off so you can put the needles in after, okay? You don't want to needle into a gummy area, okay? Any questions about the
You
seeds?
do both ears?
Yeah.
One ear, both?
You do
Oh,
both ears, yeah. Yep. You can actually teach people, send these to people in the mail, and NATA has some great tools on AccuDetox.com, some great tools around how to teach people how to do this on their own, to actually put these seeds on, right? It's possible, just with a little practice, so yeah. And in a Zoom format, you can teach people how to do that. You can work with them like this, right? So these are really, really affordable too. So magnets are a little less affordable. I think, you know, like 10 of these cost $10. The same amount gives you this, you know, this amount of gold tabs. So with the gold magnets, these particular ones just don't stick as well. So something to be mindful of. The Band-Aid on these are stick a lot better. You can also get your own Band-Aids and create your own kits, right? But this right here, the magnet, is going to go on the back Shenmen point. So I want you to find your Shenmen point, and then I want you to go to behind that point. And you're just going to go to behind the point, and that's where you put this magnet, okay? I'm going to show you here. We're only going to do one magnet on that back Shenmen point. The magnets can have a more sedating effect. They can be very powerful. This has been used a lot. They've done some research on this and some case studies on the use of this for kids with ADHD, focus problems. So yeah, and but also, you know, kids aren't the only ones that have focus problems in this world, you know, so adults too, you know. So and it's good for, I find it helpful for anxiety with patients too. And I wouldn't do both seeds and magnets. I would just choose one or the other. All right. You can also do seeds on the back Shenmen point as well. All right. A lot of kids like having on the back of their ear, so they don't have to show the other kids in the school that they got this thing on their ear. So yeah.
Is there a difference as far as any other difference with them?
You know, metal is used in Chinese medicine for dispersing energy. It's got like a and seeds are used for tonifying. So think of it as like a excess condition. You might want to use, like, you know, magnets might be more appropriate, where seeds would be more tonifying for the deficiency. But I mean, I guess I general, if people are coming in for specifically addictions, food cravings, nicotine cravings, different types of cravings, then I just use the seeds. People come in more anxiety, ADHD, like focus problems, then I use the magnets. So yeah. And I personally like teaching people just how to use their ear without anything on it, without any tools, just to give themselves self acupressure. Yeah. So yeah, so you can try practicing on yourself, on the model ears, and with your patients right away. So yeah, and then as I said, AccuDetox.com has got a lot of great material that they're coming out with, some infographics on educating people about seeds, because they're one of the best things that NATA has to offer right now is seeds and beads. So So yeah, what else around needling and technique and safe practices were you hoping to come in today that we didn't hit on as much or at all? Me? So one of the things we didn't cover is the different effects of each point, right? But there's a lot in the NATA training manual about each of the points. There's a lot of readings in your extended reading list about all the different points and how they connect to the different elements of Chinese medicine. Okay? I think less of the NATA protocol as this point does this, and then that point does that, and then this point is a special button for that, and then this is a special button for that. I understand it as a whole approach. As the points work together, right? Just like I'm not enough to heal the world right now. You're not enough to heal the world, but together we're working together. We're working as a team, right? We're understanding on that level, right? That's what we're trying to get to the root of healthcare problems, you know. And the root of a lot of individual problems is less like that this person has this little thing that needs to be fixed. We need to go in as a surgeon and fix that little thing. We're looking at there's problems with, you know, if there's a problem in anywhere in that person's body, in that person's complex, there's problems throughout their health systems, you know. And that person is not just suffering in a bubble; they're suffering within a social context of injustice and inequalities and disempowerment. So yeah. So yeah, what other any questions y'all got? Go ahead, Bonnie.
I have a question around like intake forms and that kind of thing.
Yeah.
Yeah, especially for me right now, the College of Acupuncture of Ontario tells me that I have to have the full intake, the 10 questions, the Chinese medicine intake. Can you help me figure out some ways around that, or how to simplify that for NATA?
And so this is the board of acupuncture up there?
Yeah, they want the full you know, intake health history questionnaire done with every person. So I'm just wondering, you know, if any suggestions on how I can simplify that for the NATA process to
Do they have,
so it doesn't take an hour for each person.
yeah, and is there, so, and this is like a recommendation, or like, I mean, I'd be curious to know more how like they're implementing this and how they're supervising it, monitoring it.
Yeah, it's not monitored at all unless you know, somebody complains and then they want to see my records, that kind of thing. So the other thing is, I'm not sure, I may have to phone and ask if it would apply to volunteer work the same as it would apply to my clinical work. So yeah.
I would start by calling your malpractice provider and starting there. Now, because malpractice providers have a little bit broader picture, most malpractice providers understand that NATA is a much different beast, right? They know that most of the complaints in the acupuncture world come from full body acupuncturists, not from NATA providers. Don't ask the 10 questions. So, so I think I would start there and start with there, ask for them for suggestions. And the other thing I would do is it might be worth contacting NATA, talking to Sarah at NATA, and then then the other person I want to give you a contact for some other NATA folks in that area. Okay.
Okay, and even if I have to ask for some, you know, just some supporting documentation to send to the board here or to the insurance companies to make sure that I'm okay. Right now, as far as I understand it, we are required to get that health history and the whole background before I touch anyone.
there aren't, I thought there was a regulation around NATA providers in Ontario. Is there not?
Not that I know of, but I can check for that too
So-
then, if there's a
Yeah, I would
specific.
contact NATA, and
Okay.
let's get you in touch with NATA, and you can ask Sarah directly about getting in touch with other NATA groups and other NATA programs, because there's a lot of NATA programs in Toronto
Okay, yeah,
from that
yeah.
I know of, and they've been incorporated into hospitals, and so it might be some there might be some like education that needs to be done within the board for
Yeah.
an exception, and but you could be a huge part in that. So that's so yeah.
But everything in Ontario happens in Toronto too. Like the rest of the communities are like the boonies.
Yeah.
Yeah.
You got NATA's contact?
I can find it for sure.
Okay.
Yeah,
NATA
it'll be-
office at AccuDetox.com. Okay.
Okay.
So that's any questions like that around your local area. If you want to get in touch with other NATA programs in your area, just go ahead and email them, any of y'all. So yeah.
Okay,
And then out
thank
of
you.
this class, you all, another form I need y'all to sign. I'm going to send a follow-up form. I need y'all to sign your NATA application, which is going to be your 1-year membership to NATA. Okay. That's included in the cost of this course. And so yeah. And what was I going to say about that? So that your membership's included in this course. NATA's policies has been that you have 1 year after you start the training to finish your full internship. But NATA, with the situation now and with the online trainings we're doing, they're willing to be flexible with that. Okay. But the NATA office will be reaching out to you throughout the year to check in on you. And you have access to their online portal, which has a lot of resources, and the NATA membership cafes. And you can talk to NATA and figure out what other resources they can have for you right now, right? Because so those are all, they're there to support you in addition to me as your trainer supporting you. So yeah. So yeah, I need y'all to send me in that application. And it's going to have the price, but just leave the price blank. I just need that, and then I'll pay NATA for your membership. Okay. So yeah, NATA doesn't require you to renew your membership every year or continuing education. NATA's really fought hard, so we don't need ongoing continuing education to be an ADS. But it's a great organization to support in years to come. They're kind of the backbone and keeping this all alive and keeping trainers like me in line, so we're not all over the place doing the random stuff. So that we've got a similar model we're trying to bring into healthcare. So yeah. Yeah. I'd be happy to stick around a few more minutes if anybody has any other questions about, what their next steps are, but we'll be in touch regarding a survey. I really appreciate any feedback, getting your application in, and then we'll continue to stay in touch about that day in the future when we can get together and do an in-person training. Okay. Cool. But thanks so much for joining me, and thanks for sticking it out through all this. Yeah, and congratulations. I mean, you all are
Thank
the
you.
first
Thank
to
you.
get through this. One more thing, I just realized one more thing that I gotta put a plug in for that I encourage you to do right away is to just go ahead and finish your ADS exam and send it in. Because if you wait a month, this information is going to be stale and it's going to take you longer and longer to get it done. So what I would do is just get it done in the next few days because the information's fresh. You just had 2 classes this week, and if you're having trouble getting that exam done, if you're getting stuck along the way, then just send me an email. We'll set up a time to talk and we'll figure out what you missed along the way. We'll figure out what we can do to refresh you, or if something's not clear on your end, that's my job to help you. Okay, Kelsey?
So if the exam is just the paper, it's in the stuff you sent us. And
Yeah.
so we just go
I'm gonna
through it.
go ahead and send it again in the chat here, and that was all. But it was also in your in the stuff that I sent yesterday. So
Cool.
it's just a 1 to 2 sentence answer to every question. Just a simple answer, just so I understand that you get the gist of what we're talking about, you know. And so yeah, some of the questions will go deeper into regional issues that and your own clinics issues that you might want to be aware of and getting you ready to get going. So I just put that in the chat there. Exam ADS standards of competency, okay?
Okay.
Any questions about that or about Dropbox or all that stuff? Cool. Well, thanks so much.
Thank you.
Yeah. Thank you, everyone, and
Yeah,
thank
thank
you,
you
Ryan,
all.
so
Thank you.
much.
Let's keep in touch.
All
Yeah.
right, stay safe,
Appreciate
okay?
it.
And
All
keep
right.
me posted on how you're doing,
Bye.
okay?
All right.
Keep me
Thanks very
posted
much.
on your progress,
Bye,
okay?
guys.
Bye.
Bye.
Thank you. Thank you.
Thank you, and it's been a pleasure to get to know everyone.
Thanks, Ingrid.
Thank you very much, Ryan.
I'm so glad you joined us. So yeah.
I am too.
I have one more question.
Sure, Bonnie.
Did the kit actually get sent out my way? Should I be watching for it?
Yeah, it did.
Okay,
I just
okay.
don't know when it's gonna come.
Yeah.
So yeah.
All right, yeah. So if it doesn't come like in 6 months or so, I'll let you know.
Yeah.
So
Cool.
hopefully it'll get here. Thanks very much. That was awesome.
You're welcome. All right, we'll see you.
Thank you.